32 Hospital Site Development Plan, Senator Recto. SB 1425, Institution of Regional Center of Excellence for Healthcare, Senator Revilla. Senate Bill 1505, Regional Tertiary Care Hospital, Senator Lapid. Senate Bill 1559, Build Program for Hospital and Other Health Facilities, Senator Revilla. And then on specialty centers and hospitals, SB 1133, Regional Health Centers, Senator Recto. SB 1134, Regional Kidney and Transplant Institute, Senator Recto. SB 1135, Regional Lung Center, Senator Recto. And SB 1873, Satellite Specialty Hospital, Senator Angara. So let's start with the premise. As I welcome everyone who is here today, I just like to for the record, declare some of the principles that I personally am trying to follow, and that is recognizing that the constitutional right to quality and equitable healthcare services of every Filipino. And also because I happen to chair the Committee on SDGs, Innovation and Futures Thinking, I always bring into the discussion our commitment to the UN 23 Sustainable Development Agenda, and that is good health, no, in this particular case. And so part of that commitment is that we provide substantial investments and resources across the sectors, including healthcare, to achieve those goals. Kasi pwedeng puro salita, wala namang pondong nilalagay. So clearly, we all know that COVID-19 has put a spotlight on healthcare and has revealed our gaps in our systems. We all know that healthcare services must go on despite COVID, and there have been many instances that they have been compromised. So one of the pressing concerns we need to address is our investment in health infrastructure. Obviously, there is limited budget. One of our budgetary source is the Syntax incremental revenue, which funds the Health Facility Enhancement Program. We passed that a year and a half ago. And then we also need to ensure that we are allocating these limited resources to address those gaps. What I've seen over the years, and this is coming from my experience having chaired the Committee on Health for almost 10 years in the early part of my Senate days, is that there really has not been consistent prioritization of healthcare facilities investment. So I'm hoping that we can get the support of our colleagues at this time, since everyone is now aware of the importance of this. We are not, although it may be, you may have noticed that the bills, a lot of them refer to specialty hospitals. Please note that the importance of basic healthcare and universal healthcare is not lost to us, no, as the chairperson, as currently the chair hearing these bills. I am very conscious of it, and in our discussions, I will bring back the discussion to the importance of basic healthcare spread out throughout the country. But nevertheless, I do believe that we should also be investing in innovations and in technologies and tertiary healthcare facilities, so that we can also have that whole picture of a complete healthcare system. On that note, I think I've said what I need to say. Is there any other senator that joined? Because otherwise, I will start giving the floor. I will just acknowledge the guests as they present, no, so we can save time. Okay, so let's go straight to DOH. Since there are only a few senators present, feel free, Senator Nancy, like I said, ikaw pa lang ang nakita ko. Feel free to interject anytime. Pag dumami na, that's the only time naman that I will be a little bit more proactive in, streamlining the discussion. Pero kung mga dalawa, tatlo lang tayo, feel free anytime, no? So, sige, let's proceed. To start the discussion, and we've had previous meetings with DOH, we've asked them to show us the overall picture, where they are, what they foresee to be the problems or the needs, to present that to us, no? So DOH, Yusek Lilibeth David will be presenting. Yusek, you have the floor. Go ahead.
Sorry po. So thank you po, Madam Chair, Senator Cayetano, and also to Senator Nancy Binay. So maybe the first thing we will do po is to give a comprehensive view of the specialty care development in the country that we find in the Philippine Health Facility Development Plan of 2020-2040 po. And can we share our slide po?
Yes, the secretary, our COMSEC will assist you.
Thank you po. So in the Philippine Health Facility Development Plan, we've looked at all the health facilities in the country, what we have as a baseline, identified the gaps. But what we will be focusing on here po is yung specialty care so that we can save time. Next slide, please.
I mean, if it will only take you 2 to 3 minutes, sama nyo na yung overall picture. Kasi like I said, yung appreciation namin sa specialty care cannot be taken in isolation. No? I very, Senator Nancy was nodding her head. No? We're very strong supporters of basic healthcare. So baka sana ma-include na rin yan sa general presentation.
Yes po, Senator, we included the situation on primary care facility. So if we look at primary care facilities in the country, half of the population still do not have access to primary care facilities within 30 minutes. When we talk of primary care facilities po, we're talking about the rural health unit and the health center. And this is a very key facility in universal health care because PhilHealth will be rolling out primary health care benefits. This is to unload all our higher level hospitals of the primary care that they have to attend to. And we know po that this is more cost effective to focus on primary care facilities. So even in our proposal po for 2022, we've focused on funding all the primary care facility needs over and above po yung barangay health stations. Cognizant of the fact that PhilHealth will now be rolling out primary health care benefits, and we have to prepare the primary care facilities in the country to be able to take part in this primary care services for populations in our area and funded by reimbursements from PhilHealth. For our primary care facilities po, we've mapped out 2,593. Approximately for private facilities, it's 1,500. And we see that 50% of our population still do not have access to a primary care facility within 30 minutes. So yung goal po natin is sana all our population will have access to a primary care facility within 30 minutes. So these gaps are usually in Barm, Bicol, and Mimaropa. Next slide, please.
So sorry, balikan ko lang yun. I think I want to understand that a little bit better. So when you say, so 50% of the entire population do not have access within 30 minutes, di ba?
Yes.
Pero yung 50% na yan, nakakoncentrate dyan sa areas na yan, Barm, Bicol, and Mimaropa.
Yes po.
Well, that makes it quite easy kasi, I mean, of course, the number is the same, but I think it's a good sign that the vast majority of the regions are on track, right? I think that's a very good sign. Parang napabayaan lang, which is bad. Pero as opposed to, you know what I mean? Like, parang magbubuhos ka lang sa ibang lugar, no? So, and I mean, yung, like obviously NCR, that's very populated, diba? By way of population, no? So, I'd rather see it that way, to be honest, than sobrang all over wala. Ibig sabihin napabayaan lang yung mga areas na yan. For me, that's how I see it. Anyway.
Yes, Senator. Actually,
yeah, si Senator Nancy, pakinggan natin, tapos isang sagot ka na lang, Yusek. Thank you. Yes. Senator Nancy, go ahead.
Just for clarification, yung 2,593 is the existing number of rural health units and health centers.
For the need, tama.
Yes, Senator Binay.
But what is the need?
Akala ko need. Buti kinlarify mo yon. Akala ko that's the need.
So parang ano po to? Kasi 50% of the population still do not have.
O di doble. O di pareho kami tama.
Doble. Siguro, Yusek, baka you can just submit to the committee. Baka para mas, mas detalyado kung saan
Yes.
talaga yung remaining 50% na kulang. Kasi you've mentioned nga, majority is in Bicol, Barm, and Mimaropa. But maganda din tignan kung sa NCR ba, meron pang pagkukulang or okay na tayo. And kung saan pa dapat more or less yung okay naman siya, para mas makita talaga namin, and if there's a need to allocate more funds sa area na yon, pwede din namin gawin.
Yes, Senator. We can give you disaggregation by region and by province po.
So wala kang slide nun ngayon? Wala sa presentation mo ngayon?
Wala po, Senator.
Okay.
Sorry po.
Sama mo kaagad, no problem. Sama mo lang agad because that goes into our, pati naman yung budget ng health. Ako rin naman ang humahawak, and Senator Nancy is very involved. So I'd like to be able to really settle this issue. And if it's in your presentation, then go ahead. But if it's not, my other question or suggestion, sa akin lang offhand, you know, the beauty of the lack being predominantly in a few defined areas is, wouldn't it be strategic? Now, of course, the goal is 30 minutes, di ba? Pero if for the time being, di ba, kunyari, walang-wala doon, then meron ka nung doon within 1 hour. Di ba? Because I don't think magagawa mo yung 2,000 na yan in 1 year. No? That was took how many? Maybe a decade or more to complete that. So how will you address that in the years to come? Is the 5-year rollout plan? May ganun ka bang presentation? Wala.
For primary healthcare facilities po,
Yes.
we are trying to fund all po on a 30-minute access level because of yung primary healthcare na priority natin, which is stated in the UHC. And
So
also
because,
because
that's your goal to fund it this year, next year.
this year and next year po. And then
Sige, patingin sila. Okay, we'll wait. Sige, show us na lang the cost and everything. Sige, go ahead.
next slide, please.
Madam Chair, last na lang before we move to the lahat ba no existing na primary healthcare units may staff, kumpleto yan sa staffing, like may doctors ba yan, or yung doctors ba yan once a month lang nagpupunta, may ganung, what is the complementary health workers dun sa mga rural care units natin?
So kulang pa po tayo in terms of HR for our health centers and rural health units. And even po for this Philippine Health Facility Development Plan, we're still detailing out po the HR requirements.
So Yusek, meron tayong mga healthcare facilities na may building pero walang tao. Ganun po ba yun?
Hindi po. Those existing po na RHUs still have a lack of manpower. And for those under construction po, it's an agreement po with the local government units that they will provide the manpower even as we help them in the infrastructure and equipment.
Siguro, Madam Chairperson, Yusek David, can you also submit to the committee itong deficiency pagdating dun sa manpower for our rural healthcare units? Yun lang po,
Yes.
Madam Chairperson. Thank you.
Okay po, Senator.
Yes, thank you. No, I appreciate your question, Senator Nancy. Yusek, ganito, ipapasubmit ko talaga sa'yo yon. Pero be prepared for the next hearing where you can explain it because I will have another hearing pa naman talaga eh. So be prepared in the next hearing to present because it doesn't make any sense to fund 2,500 facilities if yung lack mo of healthcare providers is so bad that even in the 1 year that you will give to construct those facilities, it will not even within 4 years na hindi ka makapag-graduate ng ganong karaming nurse. You know what I mean? So we need to understand that, di ba? Now, if it's just a matter of hiring, pero according to your database, we have those number of nurses, okay, but I'm letting you know that in meetings that I've had with health professionals, parang in 100 years, hindi pa daw natin mako-complete daw ang ating nursing requirement. And it's higher for the nurse pa pala than the doctors, and yet, ang na-prioritize natin for legislation was doctors, no? So I really need to dig into that, no? Can we be clear about that, Yusek? Okay, because that goes to funding eh. So sa akin din babagsak yan, sa amin din yan eh. So if it turns out na kaya mong magpataoy, it may not be complete, like you said, okay lang, pero let's say ang requirement sana sa ganun is, example, 1 doctor and 5 nurses and you only have 2 nurses, okay lang, kasi sa wala, di ba? Pwede namang gumana yon. Pero yung walang-wala, we have to figure out, or like as Senator Nancy said, kung isang doktor lang yan na pag ganun, pwede naman. I mean, a lot of doctors do that, di ba? They have practices in multiple hospitals. But I'd rather nakalahatiin mo tong target mo, kasi yung doctor gumaganon, kesa sa naman yung walang-wala, nakatayo, di ba? Am I clear, Yusek? That's what I really, really need. And then, I will add to that, sama mo na to ha, kasi sabi ko nga, may hearings pa to because kabit-kabit yung issues eh. I've mentioned this, but I don't have a bill filed, Senator Nancy, baka you wanna join me. To look into other healthcare providers that complement the healthcare system that we do not have. Kasi nga sa US, meron silang nurse practitioner and doctor's assistant. And as far as I know, it's just a 4-year course. And those are the kind of practitioners that are in their barrios. Meron pang Netflix yan, magandang kwento kung gusto niyo ma-inspire. I will text the name of that Netflix story. Ganun kasi doctor's assistant nga lang yung pinapapunta sa mga probinsya kasi nga kulang kahit sa Amerika. So pero tayo hanggang ngayon wala tayong ganun. And then yung midwives,
actually, Madam Chair, di ba parang midwives yon? Parang
more. No, I was about to get to that. I found out when in my first few years in the Senate that how come yung midwives in the UK, and I think in the US, but I'm more familiar with the UK system, parang ang laki ng authority nila to handle childbirth cases compared dito. Yung pala yung years of study din nila mas mahaba sa years of studies ng midwife natin. So mas nabibigyan din sila ng responsibility. So can we please study that once and for all, no? Now that I'm handling this, I want to see that whole picture because if hindi rin naman natin makokompleto yung needs ng doctors and nurses, edi ano ba naman yung i-tweak yung course ng mga nurses na yun na, pwede na silang may 1 supervising doctor sila pero baka 3 ospital yung hawak ng doktor na yon, di ba? 3 health center pala. Tapos pa ano-ano siya. Kasi sa US ganun eh. Ba't mas mayaman ba tayo sa kanila? And we will never achieve this without looking at the health human care resource. So Yusek, pwede?
And siguro just to add, Madam Chairperson, baka kailangan, there's also a need to review yung access within 30 minutes. Kasi baka,
it's a pie in the sky. Baka it's a pie in the sky, di ba?
Yeah, di ba? Baka it's just a dream. Or, kasi nga, di ba, lalo na because of COVID, alam natin talaga na magkakaroon ng pagkukulang dun sa health workers dahil marami rin sa kanila ang tinamaan ng COVID, di ba? And alam naman natin abroad, there's also a big demand.
Yeah, so we cannot compete.
We cannot compete, di ba? So,
for practical purposes, to reassess.
Yes.
Agree.
And siguro, just to share, in a way, Madam Chairperson, kasi parang naging playground ko yung periculture center during the time of President Marcos. My mom was our barangay doctor. So dito sa barangay namin, meron yung periculture center, 'di ba? Ang setup dati may preschool, tapos nandoon yung clinic, tapos sa taas may library, and then may doctor na so my mom nagjo-duty siya doon, pero hindi lang naman doon siya nagpa-practice, 'di ba? Maybe umiikot din siya. So maybe that is something that we can review kung ano ba yung naging setup during that time nung meron pa tayong periculture center.
Agree, I'd be happy to look at it.
Kasi yung kompleto yun pati dentist meron. So I don't know kung itong rural health unit natin may kasamang dentist yan.
Sige, I like that.
Ano ba, Yusek?
Dapat po, pero kulang po tayo sa dentists eh. So meron lang pong itinerant dentist and we're proposing po na dental assistant kasi medyo parang 4 semesters lang po yata yung course na yon.
So technically, Yusek David, yung facility din natin, wala rin yung clinic for dentist.
Meron na po yung iba. We've started providing that po. Pero kulang po
Okay.
talaga tayo ng dentist. But we see po na for primary healthcare, pwede na po yung dental assistant because they can do scaling of dental plaques, mga ganun po, and yung education.
Okay,
Okay.
okay.
And siguro one na lang, Madam
Go
Chairperson.
ahead, go ahead.
Kasi di ba there's this project na nagkaroon ng issue. Hingi lang ako ng status ko na nangyari dun sa supposed to be parang rural health units na pinatayo. Di ba some of them sa loob ng eskwelahan. Ano na ho ba? Nagagamit na ba natin to? Or may hold pa din ba because hindi nabayaran? Di ba parang may ganong case yun, Yusek David?
Yes po, those are not rural health units po. They are barangay health stations. And they are still under litigation po. So, hindi po pwedeng galawin pa po.
So at the moment, hindi natin nagagamit itong ano na to. But we've paid for it, right?
Meron po tayong advance payment, pero because it's under litigation, we cannot use it and we cannot make any further payments po to them.
So lahat, kahit ready na for use, hindi pa rin nagagamit because of the litigation?
Opo, pero konti lang naman po yung functional, yung at a functional
And
level.
how much have we paid? Ilang percent na dun sa...
I'll have to check po and give you the data later.
Sige. Oh, well, Madam Chair, baka it's meant for another resolution kasi isipin mo, we've spent for this and alam naman natin na kailangan natin kahit barangay health station lang siya, di ba? But if it's ready, dahil lang sa litigation, hindi nagagamit, sayang, di ba?
Oo. Yusek, let's spare Senator Nancy the need to draft a reso. Of course, you're free to do so, Senator Nancy, if you want to, but kindly consider that request, non-official request for the data. And if you want to file the resolution, go ahead, Senator Nancy. I'm with you on trying to find it. Kasi sabi mo, nandyan na yan eh. And even if you say na, let's say, maliit, konti lang sila yung usable, paano ko yung kalahati doon, 50% done? Diba? Di 50% din less ng ano natin. Anyway, we want to know. Okay?
Yes, Senator, we can provide you the data also.
Naghahanap tayo ng mga vaccination centers. Kung pwede na palang gamitin yan as vaccination centers, why shouldn't we not use it, right?
I want to add something to what Nancy said earlier about how realistic is that 30 minutes. Wala naman tayong problema if that's the ideal, di ba? But let's be clear, that's the ideal. No? If that's the gold standard, if that's the international standard, let's be clear na that's the standard. But para ba tong sa education na may last mile schools, yung bang meron talagang regions that will be hard to reach? Again, my example will be similar to education because if you'll recall, Senator Nancy, I shared photos of a trip that I made to the Benguet area. And Yusek, explain ko lang sa inyo, kasi sa education namin ito na pag-usapan. Yung binibisita kong barangay, it's roughly a 2-hour trek to get to that barangay. Okay? 2-hour walk to get to that barangay. Tapos, yung parang head teacher, I don't know her official role, parang supervisor doon sa school na yon. Hindi pala siya nakatira sa barangay na yon. Pero every time I visit, which is not naman that often, like I visited twice nung COVID, pero prior to that, it was like 2 years before I had come. They go, kasi syempre natutuwa silang makakwentuhan ako. So, lagi ko siyang tinatanong, kumusta mang biyahe? And ang biyahe niya is 4 hours by foot. So ako, 2 hours ko yun. May pa-training pa ako para kayanin ko yung 2 hours siya. It's 4 hours because she lives in the neighboring barangay. And she's the supervisor of those 2 schools. So, again, using by analogy, yung tanong ni Nancy, yung doktor, di ba? Paano mangyayari? Ang dami nating lugar na ganon, di ba? So, we're just curious na how many ang ating mga areas na geographically isolated. It might be small in the context of the densely populated cities, pero we still want to know, para if we say, well, we need to carve out 500 who really, no matter what, it's really a 2-hour trek nga away. O di, alam na natin na parang last mile school yun. We identify them as such, di ba? Hindi yung parang akala namin at the end of this hearing, wow, mapupuno na natin yung 2,000. Parang medyo impossible yon even given yung tinrek ko on my own because it took more than almost 2 hours to get to that barangay from the barangay hall to the barangay hall which is nasa Cemento pa to visit one of the ano ba tawag doon yung mas maliit pa sa barangay, yung community. Yun yung 2 hours, but that's the same barangay. Okay? Just to illustrate our concern. Sige ma'am, ikaw na, go ahead.
Thank you po, Senator. So, the other data po na hiningi nyo, we can submit that po. So, let's go to hospitals. If we look at the bed density, the Philippine bed density is comparable only to countries in sub-Saharan Africa. So, we only have 1.2 beds per 1,000 population. So, if we look po at the bar graph, yung red po yung sa Philippines, it's only 1.2 beds per 1,000 population. So, kapareho lang po natin yung Sub-Saharan Africa, low-income countries. And if we really hope to become an upper-middle country, the target that we want to have is at least 4 beds per 1,000. If we look at the highest bar here. Next slide, please. Next slide, please. So in universal healthcare po, we are trying to develop networks of care. So if we start from the bottommost po, we have a primary care provider network composed of the primary care facility or the RHU or the health center that will now provide diagnostic services, other services po, and drugs and medicines, and linked to outreach facilities that are barangay health stations. So they have a catchment area of a specific number of families. And this primary care provider network is now linked to a healthcare provider network. This healthcare provider network provides hospital services for level 1, level 2, and level 3 for every primary care network. And these healthcare provider networks of general hospital care also links its catchment population to apex hospitals that provide single specialty hospital and other general hospital care with multi-specialty centers. So ito po yung design natin for universal healthcare for the network of facilities that we want to provide to our population. Next slide.
Yusek, quick question.
Yes, po.
When you roll this
Yes,
out in terms of access of people to healthcare, did you include the existence of private healthcare facilities?
Yes, Senator. The private care facilities are considered po in the Philippine Health Facility Development Plan.
Okay, sige. So, yung ipapakita nyo sa amin would be whether it's a map, and sana be as creative as possible, no? Visually, kung may map na mapapakita, then, by way of like a graph that says Region 1, literally, population-wise, ilan yung target, para we can see, para we know na ano yung red zone. Well, you already said na yung red zone mo would be Barm, Bicol, etc., di ba?
Yes.
May
yes,
I
Senator.
know, out of curiosity, the primary healthcare facility is usually, well, or is it 50-50 initiative? I mean, obviously, you've seen LGUs na pag may initiative talaga yung LGU, sila, di ba? Marami sila. Pag wala, kulang. Pero nagbibigay din naman, nagsusupplement din naman ang national government, di ba? So, yung mga na-point out mong area, may reason ba na sila yung na-left behind?
Yes po, generally po nakikita namin po sa BARM because it's a conflict area. So we have difficulty finding HR po to reside in the area and to serve. That's the same problem po we also have with islands po.
Okay.
Because
Yeah, obviously.
Apa.
May I quickly go now to another bill that we passed years ago, which really I think is the only way that you can approach this problem. Yung ladderized education natin, which is a law, and then it's not a law, but yung talagang parang yung I don't know the term for it, pero yung parang
Step ladder po, Senator? Step ladder?
No. Ladder, no, we have a law on ladderized education, which is basically you would pull out. Ideally, you would pull out. And honestly, you could start with BHWs who want to become midwives, who want to become nurses, and so on and so forth. To study, you bring the programs to them kasi talagang sila na yung taga doon. Yung maghahanap ka ng pupunta doon, it's not gonna happen in this lifetime, especially if it's a conflict area. The people who have the biggest chance of staying there are those who are invested in those areas and have family there.
Yes.
So unless you come up with that program, it's not gonna happen. So again, like Senator Nancy says, iba naman topic yan. Pero we still have to address it kasi you're gonna give us a list that just tells us kulang dito, magpatayo dito. Yung pala yung cost nung kulang nun is the human resource, not the facilities. So you need to indicate that in your presentation, which thank you for telling us now. Pero di ba, offhand, akala ko facilities lang. Na I would have thought that because of the conflict area, there's a lot of hesitation in building kasi nga masusunog lang or lumilipat, di ba? Talagang nag-aal sa balutan mga tao, hindi na pala yun yung village. Pero sabi mo nga, it's a human resource issue din. Hindi ko alam yun. So we need to be able to understand so that we can help direct the funding and the priorities. Okay?
Yes, Senators. So we really need to make the case that for healthcare, it's really human resource intensive, and we have to be ready to make that investment. For sa atin po, we will need to increase the production po. So we really need local scholarship so that they will really go back to the area. Of course, yung return service agreements po. Sige. Next slide po.
Sige. Sorry, I just need to inform my staff. I had a meeting with a university that their focus, it's a medical school, and they have the highest rate of return sa probinsya or stay with the local communities, no? So I want to make that meeting into an official hearing so that I can get, I don't know kung familiar ka, it's actually Ateneo de Zamboanga. Higher pa yung rate nila ng PGH from what I know than any other school. But again, let's look at the data. Pero talagang nakababad sa community yung mga doktor nila kasi yung curriculum nila is based on community work. So until you also change, kahit ano pang sabihin mo, hindi magko-community based kung hindi sila trained that way. Okay, so anyway, again, it's another focus. Di pa tayo maka-move forward, but it's all interrelated. So I'm mentioning it so that my staff can take note that we can include it as a 30-minute discussion, maybe in the next hearing to see that picture because I need PRC, CHED, all of them, these med schools to be on board. Remember, Senator Nancy, we passed the doctor para sa yes, we want specialists, we do naman, pero there's still that dearth, there's still that need for like basic family medicine doctors, di ba? Hindi lang yung puro specialization. So anyway, that's where we are. Thank you. Go ahead, Yusek.
Yes, Senator, we agree with you. We should use the phenomena na when you put up a medical school there or a health allied professional school, mapapopulate po yung local area. Like in CAR po, nag-set up ng medical school doon. Lahat po, pati remote na areas in CAR were filled up with HR. So, maganda po yun, Senator. Next slide, please. Next slide, please. So now we'll focus on the development of specialty care in the country. We made it a resource stratified specialty care wherein we locate the specific specialty care on the specific level of service so that we can develop the specific capacity relevant to that level. So we have two big boxes here, general care and specialty care. So for all the specialty cares developed for the country, there are also corresponding general care to be provided in intermediate and primary care facilities. But we will focus now on the specialty care po. For specialty care, we have designated basic comprehensive specialty care, advanced comprehensive specialty centers, and national specialty centers. And we have developed 16 specialty services to be established in the country po. Next slide, please. Next slide, please. So the criteria for development of specialty centers for the country in the Philippine Health Facility Development Plan is based on the top burden of disease, of which we have the list here, special laws and mandates requiring such specialty care in the country, and we also have the list, and also other special needs that we saw, particularly OPSA, toxicology, and dermatology. The exclusions were those integrated in the service capability of general hospitals like reproductive health care or pediatric health care, which should be found in which service must be found in most of the health facilities. Next slide, please.
You said can you retain it? I had a reminder to install Adobe, which is not relevant, but I lost you for a second. I could hear you, but I want to take a few seconds to look at your slide. Yusek, sana meron kang meron kang arrow that shows which of the top burden are actually already addressed by law. Or ito na ba yun, na when you say special needs, that means hindi siya covered or hindi? Hindi, di ba? Iba pa yan, di ba? You're just saying, so I want to see, for example, top burden of disease, lung care. We have the law, pero how many centers do we have dedicated to it? May ganun kang slide.
Meron po, Senator.
Coming.
Subsequent slides. Opo.
Okay, good. Sige, before you go, wait, I just still want to continue look at it. Okay. Kasi this really has to be the focus because, you know, the burden of chairing the Committee on Health, which like I said, I did for almost 10 years before, is syempre kanya-kanyang advocacy, whether it's a member of the House of Representatives or a senator, or for that matter, a doctor, di ba? So kung yung specialty mo yun, syempre yung paglalaban mo because we're a developing country that is kulang in everything. But I want to really be able to focus on the priorities, di ba? So for every peso investment that we will make, dapat ma-prioritize itong pinaka-top burdens. And then we can still, I'm not saying we don't allocate to the others because if we did it, di kawawa naman, dapat naman din meron. Pero let's be clear about those prioritizations. So if you say 80% of the budget goes to what do you call this, preventive healthcare. And then of the remaining 20, of that 20, 80% of that goes to this. Or whatever it is, di ba? Let's agree na ganon. Dapat may plano kayo so that even legislators are properly guided. It doesn't mean na kung may advocacy ka sa prostate cancer o so whatever, hindi pwede. Pwede lahat. Pero yung budgeting nun has to be based on the priorities that you help set.
Yes po, Senator. Parang pareto ho, 80-20, parang gano'n.
Kasi itong mga batas na to, honestly, are passion-driven eh. Kung very passionate yung ano mo dito, yung champion mo, yung batas agad to. Pero kung sadly, walang champion yung ano mo, kunyari itong orthopedic care and physical rehabilitation, wala pa ako naririnig na champion yan. Tayo na lang, Nancy. Pero di ba, like all the seniors who have some debilitating, all the PWDs, special needs, lahat yan dadaan yan sa physical rehabilitation.
Knee replacements ng senior citizen, madami yan.
Oo. And even before they get to that stage, yung tawag nila ngayon is prehab, di ba? Yung pre, hindi re. Kung mauna nga si prehab, baka anyway, we understand each other no on this. So yun yung gusto ko kasi otherwise sadly it's passion driven, which is nice, but kawawa yung kailangan bigyan ng pansin. And that's the case with infectious diseases. That is why we are where we are. Sino ba naging passionate sa infectious disease? 'Di ba? Parang naiwan lang yan. So here we are inabot tayo ng COVID, kakarag-karag si RITM, walang pumapansin, 'di ba? That's exactly what happened. I mean, we have passed laws on HIV/AIDS. Why? Because the people there are very passionate. 'Di ba? Pero kung hindi pa yung pre-COVID na pinag-aaralan lang, hindi mo pinapakinggan yung mga experts eh. Anyway, that's my point. Sige, let's move on. Thank you.
Okay.
Senator Nancy, go ahead.
Yes, no, just to share, kasi nga katulad yan before pre-COVID, in one of the budget hearings, yung RITM nga, binawasan pa ng pondo yung surveillance niya. So can you just imagine talaga dun sa priority, wala talaga siya. Kasi nga, walang may advocacy about that. And here we are right now. 'Di ba? Buti na lang nga dun sa RITM on their own may initiative. Kaya nga nila na-discover na may bumalik na ulit yung polio. Kasi on their own, kahit kulang sila sa budget, they did the study, di ba? But kung walang ganong initiative, wala. Yun lang, Madam Chairperson.
Agree 100%. Sige, Yusek, please proceed. Thank you.
Okay po. Next slide. So what are the roles of the different specialty centers? The Comprehensive Center, Advanced, and National Specialty Center. We'll start po from the rightmost side, the Comprehensive Center. So the base facility for location of this will be our regional level 3 hospitals, and their role is to develop their capacity for managing simple specialty care and some complex cases, and of course full clinical services. For Advanced Comprehensive Center po, this will be located in subnational level 3 hospitals, and they have to develop the capacity for managing most of the complex specialty care, and may have a higher level of clinical service, training, and research. The highest would be the National Specialty Center, and usually this is located po sa National Specialty Hospital, and they do the policy making and protocol development for this specialty, and they develop the clinical pathway, and develop the capacity of managing all cases and end referral with highest level of clinical service, training, and research. Next slide.
Yusek, balik mo doon. Kaming dalawa ni Nancy.
Okay.
Mauna ka,
Madam
Nancy. Go
Chair.
ahead. Balik lang yung
Siguro-
picture. Yung...
Yeah.
Okay
Siguro para mas maintindihan, kunyari may sakit
Previous
ka,
slide,
may sakit
please.
ka sa, this slide. Okay. Kunyari may sakit ka sa puso, ano yung pwedeng gawin sa'yo sa comprehensive center, ano yung sa advanced, at ano yung sa national specialty center? Para mas ma-differentiate namin yung tatlong centers.
Agree. Kasi it's too technical for us eh.
Okay po. Sige
Like
po.
what would you mean when you say regional 3? For me kasi regional 3 na yun, di ba? Dapat mabigat-bigat na rin yung kakayanin niya. So when you talk about heart, anong klaseng condition sa heart ang pwede, di ba?
Yeah.
When you,
Pag
like,
regional 3 ba, pwede na mag-angioplasty dyan? Or,
Yeah, so we have some
ganun-
examples po later
sige.
kung what kind of services will be in these specialty centers.
And then kung ano din yung target, like how many? Para lang again, naano natin yung budget niyan.
Yes po, Senator. We will present po. Sige, next slide po tayo. So how did we come up with the stratification of specialty care across all levels of specialty services? So una po, we made a technical working group. So they drafted this, and then there were stakeholder consultations done. And then they then finalized the development plan for specialty centers across the country, identifying the care that should be at each level, identifying the specialty centers, and then validation ho with hospital technical working groups, and then the DOH execom po. So next slide. So now that we have developed yung ating resource stratified specialty care framework, how do we execute the plans that have been developed? So with the Philippine Health Facility Development Plan, we have planning workshops with the designated specialty hospitals. And for this year, that planning was done in February with the specific hospitals. And then the hospitals are then have the responsibility of developing that capacity by submitting the requests and proposals in their annual budgets po, annually until 2025. And then, of course, we have to monitor that the targets per year and for the 5 year until 2025 has been met. Next slide, please. If we look at some specific specialty care, we identified capacity of hospitals to be developed as lung care lung care specialty centers. So dito po nakikita po yung tinatanong nyo kanina. If you are, let's start from the rightmost po. If you are identified as a basic comprehensive specialty center in the regional level, then you have to develop the capacity for advanced and complex surgeries, including minimal access surgeries. So marami pong other requirements ito. If you are identified as an advanced comprehensive specialty center, then you have to develop yung capacity mo for specialized lung surgery, fluorescence, surgery, lung volume reduction surgery, basic interventional pulmonology procedures, basic central airway procedures, among others po, no? And then for National Specialty Center, of course, lung transplants, robotics, advanced interventional pulmonary procedures, and advanced central airway procedures, among others po. And they also lead in... Yes po, Senator.
Question lang, I have to admit, di ko pa rin naintindihan, pero wala tayong magagawa doon dahil hindi ko talaga specialty yan, ano. That's fine. I mean, as far as your presentation, feel free, Nancy, kung may special examples ka pang gusto. Ako kasi limited yung understanding ko because if we talk about hepatology or liver, yan, medyo mas familiar ako because my father had a liver transplant. So I kind of know the whole range from vaccination all the way to transplant. Ito, hindi ko to gamay. But on that note lang, my question naman lang kasi is, when I visualize a regional center na may ganyan, I want to hear your presentation that includes recruitment for people to go there because I'm familiar with an area in Mindanao, and at this very moment, I don't know if my staff will remember, I can't recall, it might have been a public hospital, I can't really recall though. Now I recall. So they really wanted to level up their practice in all specialties, no. So I actually had a conversation with one of the specialty doctors, and the way she was recruited is gusto naman niya, marami naman din gusto magbuhay probinsya, especially this COVID days, no. This is really the perfect time. Ang daming gustong bumalik sa probinsya, especially if they grew up there or maybe it was the hometown of their grandparents. But what are their opportunities there? So ito yung nakausap ko, and this was pre-COVID, this is mga 2019 or 2018. Ang kwento niya sa akin is niligawan talaga siya ng hospital director. Niligawan talaga siya, tapos pinayagan siya mag-practice in a private hospital a few hours away or maybe a few days a week, whatever that is, to augment her income. So parang ganon, kasi syempre may level of income, naman tong mga to, goals, kasi my gosh, nag-aral ng buong buhay, di ba? So I want to hear kung ano din yung mga plano nyong gano'n, kasi thank God na may ganung kadeterminado na hospital director, pero lahat ba ganun mag-isip? Tsaka ano din yung sa inyo, yung across the board sana na mga incentives nyo for them to do this? O yun, ang questions ko. Can answer it now, or if it's part of another presentation, just let me know.
Yes, maybe I'll just give a general answer, Senator, and maybe the different specialty centers can also give some answers. Pero kunwari po, yung ating National Specialty Center, is the one that develops the HR for the advanced and the basic comprehensive centers. And I know that most of the hospitals, the specialty centers in the regional areas, are the ones recruiting po. Also the residents and the people who will be training under them. Pero when we really execute this po, it will be easier for most MDs who want to specialize to know kasi we already identify which specialty care is in which specialty is in which regional hospital. So they'll be very cognizant of that already po.
Right. But sorry, did I miss something kasi I was looking for any message from my staff. Did I miss something? Kasi what I wanted to hear is, may standard ba kayo na package na ino-offer to entice them to do that? Like, why would they want to do that? If you recall, we just passed CREATE, no? That is for the private sector, di ba? Ano yung incentives para dyan sila magpunta? May ganun ba? Other than the usual, because of course, these doctors get what do you call this, a portion of the PhilHealth di ba, payments, no, for the doctors. Meron naman, pero meron pa bang iba? Kasi what would be the come on to go there and invest? Like, may pabahay ba sila or whatever? Sana may ganun.
I'm not familiar pa with the specific privileges, pero yung national specialty centers ho natin prioritize the applicants from the hospitals identified to become advanced or basic comprehensive centers. So I'm not familiar pa with the amenities that each hospital provide for their trainees, but we will take up po your comment that we might need to draft standard incentive packages for them.
Yeah. Kasi if you ask me, kunyari, lalo na yung alam mong nangangailangan na lugar, minsan konting push na lang yun. Like, kunyari, sabi mong may 20,000 kang assistance for housing. Whatever that is, di ba? Hindi ko naman sinasabing bilan mo ng house and lot, bilan mo ng palasyo. Pero whatever assistance for housing, maybe assistance for schooling, I think malaking bagay sa mga doktor yun. Anyway, we can have I will have a hearing on that na lang, yung human healthcare, kasi talagang that's on my agenda. So doon natin ibuhos yun. Nancy, samahan mo ko
Yeah. Senator, they will be very happy if you have something like that.
Actually, Madam Chair, question lang. Kasi di ba sa education may complementary? Dito ba sa natin, healthcare, meron ba? Kasi, for example, in the province, kunyari, meron ng existing na private hospital that can specialize or can do the basic comprehensive. Pwede ba yung ganong setup? Kasi alam naman natin na funding will always be a problem, manpower will always be a problem. Pero kung meron na kasi yung private sector, hindi ba parang pwede na may ganong arrangement? You check the video?
Yeah. So, we allow the private practice po in government hospitals, especially medical specialists and other paramedical professionals. So we already have an admin issuance on this. But the role of the private sector in specialty care in the country is also considered po in the PHFTP.
Thank you.
Okay, go ahead.
Yeah. Can we proceed to the next slide po? So for lung centers po, we have already designated Lung Center of the Philippines as the national specialty center. And then we have identified 6 comprehensive advanced centers. And we have identified 10 basic comprehensive centers. So these are the specialty centers for lung care that we are trying to develop for the country, and the investments for such care will be focused in these hospitals. So for...
Question lang.
Yes po,
Can you
Senator.
also include kung ilang beds? Kung ilang beds yung magiging allocation?
O sige po, for all the hospitals.
Yes. Lalo na dun sa advanced tsaka dun sa basic.
Sige po, Senator. So for heart care po, the specialty care, we have, starting from the rightmost po, yung basic comprehensive center for simple open heart surgery and those things. So for advanced comprehensive care, it's for complicated open heart surgery, complex ischemic and valve surgery, and among others po. And for the National Specialty Center, it's for the more complicated open heart surgery and innovative methods, and among other services po. So these are the service capacities that these centers are expected to be developing in the subsequent years po. Next slide. For designated cardiovascular centers for the country, we have the Philippine Heart Center as the National Specialty Center, 5 advanced comprehensive centers, and 13 basic comprehensive centers.
A question. So this is
Yes,
already existing, di ba? Existing na to. They are classified as such because they are performing those services, tama?
Or they have been already receiving some training po from the National Specialty Center, but they have not yet been fully developed po.
Okay, so at least we're on track. No, we're on track. Maybe you can just code that with a green, which means, talagang all out na sila, or like a yellow, which means on track. Para lang, may idea tayo, di ba, na what's going on, di ba? Kahit lagyan mo lang ng maliliit na color coding yan para we're familiar. My question is this, for my understanding, when you say that the Philippine Heart Center is the number 1, does that mean na meron silang nagagawa na hindi talaga procedure na hindi talaga nagagawa nung nasa blue, yung advanced?
Yes po, they should be handling the most complicated cases. So yun po yung role usually ng National Specialty Center.
Oo nga, pero I mean, I'm trying to compare, let's say, Singapore, na napakaliit lang naman, di ba? Parang may sabi, parang Metro Manila lang Singapore, mas maliit pa. Are you saying in Singapore, isa lang yung ganun nila? You know what I mean? Like what are the limiting factors that Cebu wouldn't have something as good as the National Specialty Center? That's my question. Given that we're so much bigger than Singapore. And for that matter, like in the US, would you say na sa US, they have about 3 to 3.5 the number of our population? Are you saying in the whole US, tatlo lang ganun? I doubt, di ba? There's probably 5, 10, 20, I don't know. So, you know what I mean? Like, what's the reason that you would only have that one? Or for that matter, maybe for our understanding, if there also happen to be private hospitals that practice, syempre the private limited naman yung ability niya to help the general public kasi mahal. But I'm just curious kung saan pa meron. But
Yes.
Going back to my main question, can you answer that? Like, why? Why isa lang siya? Why para bang lalagyan mo ba ng hangganan yung pangarap nung second level na maging parang first level siya?
Yes. So, Senator, I'll give a general answer and invite the specialty center chiefs if they want to contribute. For the National Specialty Center, like if we look at lung specialty care, for National Specialty Center, they've identified lung transplants as the bastion of the National Specialty Center. Pero with your statement ho, of course, sometimes in some specialty services, baka pwede na po i-locate din the services in the advanced comprehensive. We have one National Specialty Center because they're supposed to lead the development of this specialty care throughout the country.
Okay.
Developing the policies, mga ganun po,
Yes.
standards, CPGs.
Got it. You mentioned that in the beginning. So it's more of, at some point, it is very possible that they will just be developing policy. But it is possible that those in the advanced comprehensive could be fulfilling 75 to 90% similar work, right? It's just that may pinagkaiba na policy. Okay. Yun lang naman. Kasi ang akin naman, wag mo lalagyan ng hangganan yung yung capabilities nila to just to clarify. Wag na muna natin pakinggan yung specialty kasi hindi tayo matatapos sa'yo. Dahil sa'yo pa lang. Let's give them their time to they can include that in their responses later on. Okay?
Okay po. Sige po.
Nancy, feel free lang ha. Feel free lang. Baka hindi kita nakikita. Dalawa lang naman tayo, so feel free lang to to interject.
Yeah. Madam Chair, question lang. Yung binibigay niya bang numbers na Advanced Comprehensive 5, is this the goal or ito na yon?
Ito na po yung goal.
Ito na
development is until 2040 po ang PHFDP eh.
So ito na yung more or less ito yung kailangan nating pondohan in 5 years. Right? Yusek David?
Yes, Senator po.
Okay.
This is our priorities for funding na po. If we want to expand to other areas, maybe po next phase tayo, maybe in 3 to 5 years, we review this again and see if we need to increase.
Well, what I want is a comprehensive plan that USEC and for all of those listening, I chair the committee on SDG innovation and futures thinking. So my futures thinking training dictates that we have already mapped out these future scenarios. Best case, worst case. So in 3 to 5 years, ano yung best case and worst case? And then ano rin yun for 10 years? Kasi actually the future is not, in futures thinking, hindi 3 to 5 years eh. Ngayon na yun, 3 to 5 years eh. 10 years, 20 years. So that hindi, when you say we will go back, no, we don't want to go back. Naka-map out na yan. If A happened as planned, then we can go to B. But if A did not happen as planned, then baka napunta tayo sa A.1, A.2 pa lang tayo, bumagal. But that should all be foreseen. Worst case, hindi not so good funding. Best case, as planned, the complete funding. You know what I mean? So that's what I want. Hindi yung kakapa-kapa tayo. I don't want future congresses to say, sana tayo, let's go back. No, you have that you just keep showing it. Where are we? We now had to fall to plan B kasi hindi kayo nagpopondo. Or plan B because whether it's CHED or whoever did not do their job and hindi tayo nakapagpatayo ng medical universities to train the people we need. So, hindi tayo naka-go to the next phase. But that should all be mapped out. If I might suggest, you can get in touch with DAP. My staff can assist in futures thinking planning kasi this will really help you, just to clarify, okay?
Yes, sir. Yes, Senator. Tama naman po kayo. So
Okay.
for the specialty care po, 2025, sana po fully operational sila. Pero yung PHFDP po is until 2040.
Staff reminded me that DOH, we in the 2021 budget, we gave DOH funding for futures thinking. Can you look at it? Kasi if you ask me, this planning of HR and infra is probably the most important in terms of futures planning. Please lang, kasi nandiyan na yung pondo niya, huwag niyo ibalik.
Sige po, Senator. Futures planning? Futures thinking?
Futures thinking planning. Yeah, my staff can get in touch with you naman later. Kasi like for example, si DA went ahead and had this these workshops with the mga DAP professors natin who are experts na sa futures thinking. It's really like strategic planning so that you can map out your plans this way.
Okay po, Senator.
Senator Cayetano, can I butt in? This is
Sige po.
Dr. Avanilla of the Philippine Heart Center.
Yes, Doc.
I think Yusek David is just presenting the overview. But actually, we have the details. Even into the future, we have a maturity assessment. And we have a timeline and a calendar for that. Yeah.
Thank you. That's a good intervention, and we'd like to hear that later on. So Yusek, meron naman pala, pero kahit sa level nyo kasi dapat clear yon na meron, 'di ba? That's why I keep introducing futures thinking because I want it to be a standard for all of us na futures thinking requires that we have a plan for the worst case scenario, the best case scenario, and not like, oops, hindi na tuloy, we don't know what to do, from here. Anyway, go ahead, Yusek.
Okay po. So these are the cardiovascular specialty centers. So let's now go to renal care. So for basic comprehensive
Siguro
care,
Yusek, in the interest of time, pasadahan mo na lang yan kasi we have naman the specialists who will talk. At unless Nancy wants, feel free, Senator Nancy. Ako kasi, hindi ko naman kayang i-dissect yun with my own basic understanding, no? So, pasadahan mo lang yan.
Yes, I
yes
agree.
po.
Actually,
Opo, so-
Madam Chair, pwede na nga rin hindi kasi we'll get naman a copy.
Yeah,
Presentation, diba?
Oo, please, sige.
Sige po. So this shows renal care service. Next slide, please. So these are samples lang naman po talaga. Next slide, please. So these are the designated renal care specialty centers. Next slide.
Sorry, USEC, and then in future presentations, I don't know if this will still be you or other USECs, pero I'd like you to be involved because nga intrinsically connected as it appears itong infrastructure planning natin and then the human resource, right? But I'd like to always have input, and this is where the specialists come in of the different areas. Na ano yung preventive measures? So obviously, when we talk like kunyari, my father, he had a liver transplant. In my ignorance, syempre proponent ako ng facilities for liver transplant. Only for me to find out na teka muna, hepatitis B vaccination yung pinaka-basic na prevention pala nun, which I learned many years ago. So lahat ng presentation na gusto ko nandun yon, okay? Para it's not lost to us na walang doktor sa Senate ngayon eh. I want that to be top of mind na what is the cheapest preventive care? Of course, not everyone was able to go through it. So meron naman tayong services all the way to the end. Pero what can we do so that as time goes on, dun tayo nag-veer sa investment sa prevention, which goes back to your first presentation on basic healthcare, di ba? Pero you have to tie it in to the specialties. Ano ba dapat ginawa para hindi dumating sa point na to? And I'll just share case in point when I was in WHO Geneva before COVID, yung pino-point out nga sa akin is that the request of politicians for more dialysis center is very cost inefficient. What we should really be focusing daw on is preventive healthcare. Preventive, but of course that will not save the people now who need dialysis, di ba? Pero we still have to, para the future generation will not go in that direction. So yun naman yung point ko. I mean, the average non-doctor person like us wouldn't know these things eh. Di ba? So you have to bring that back to the discussion all the time.
Opo. So these are our last few slides. So for neonatal
Actually,
care.
Madam Chair, question lang. Madam Chair.
Go ahead lang. Go ahead.
Pero Yusek David, meron naman gano'n, no? Yung preventive part.
Yes, Senator.
Meron naman gano'ng programa.
Opo. So, Disease Prevention Control Bureau po yun.
Okay.
Yes, but Senator Nancy, I love your question because it will bring to the forefront how much interaction is there going on between the people involved in prevention and the people tasked with the specialty care later on. I will let the specialist speak. Pero from my own research, kasi mahilig talaga ako, health advocate ako, no professional whatsoever. You don't have to believe me. Mahilig lang ako. I know for a fact all over the world, including the US, there's such a big disjunct between healthy living, advocacy on healthy living, eating vegetables, and then meanwhile, wala tayong kapreno-preno advertising all these packaged products na punong-puno ng additives, sasabihin pa ng Nutrition Council na okay yan, meron siyang vitamin ganyan. May vitamin ganyan nga siya, pero lahat ng additives na nakakasama sa'yo, nandun din. Walang ganun. So, at the end of 30 years, 45 years, andun na sila nakapila sa specialist. So when you say to me, Yusek, na there is a group in charge of that, yes, but I do not see the connection. I do not see that. And with all due respect din sa mga doctors, my understanding, and I would be happy to hear you address this, is that very few doctors really look into the nutritional aspect. That's why nga I like the committee I chair, which is SDG, because it forces me to also look at those other components, diba? Access to good food. And yung good food mo, again, I'll share an example. I hope you will not get bored with my examples. I don't really eat pork. So for that matter, I try not to eat ham, kahit masarap, Pasko na lang. Pero dinadagdagan ko yung protein intake ko. Pero according to the people, the nutrition research, wag daw masyadong kumain ng mga ham kasi may nitrate, may sodium nitrate, which is not good for you. Di ka naman basta-basta makakahanap ng ham na walang sodium nitrate because sodium nitrate is part of the preservative that they add there so that makain mo yung ham. So ni-research ko ng konti. Google lang naman. Well, apparently yes, it's true. Most hams have sodium nitrate. But if you really want to eliminate sodium nitrate from your diet, 80% pala of your sodium nitrate you get from plants. Because most likely the soil that they are planted in is not good soil. It's contaminated 80%. So hindi ako nag-ham because of the sodium nitrate in ham. Yung pala 80% comes from the vegetables. So yung aking mostly vegetable diet, punong-puno pala ng nitrates din. So you see my point? Yung second, my understanding is very few doctors study this because it's not part of their curriculum. So I rest my case, okay?
I agree. Pia. Siguro,
Thank
just
you,
to add
Nancy.
na lang dun sa discussion. For example, itong mentality natin pag namimigay tayo ng relief goods. Diba, kadalasan, may instant, mga instant noodles, diba?
Always. Hindi lang nyo, yung instant noodles na number 1 on the charts for all those additives. And not only that, sugar. Kasi ang sasabihin sa akin, all the discussions I've had with our people is like, kailangan niya, nabubuhay mga tao sa kape at asukal. Pero ang ginagawa natin sa kanila, parang a moment of happiness, pero not even an ounce of nutrition, di ba?
So I guess, yung discussion on healthy living is another, kumbaga, kailangan whole of government approach ata yan for it to succeed. Hindi lang kaya ng DOH and isang ahensya. Yun lang.
Yes. So, Senator, we agree with all your statements po. You have your allies in us. We're actually focusing on specialty care, but we also showed in an earlier slide that this is supported by general care in our lower level hospitals, our primary healthcare facilities. So they should have the continuum of services, including the preventive for this top burden of disease and these other specialty care concerns. Next slide po. Next slide. So these are centers. Just to give an example po of the cost for our specialty centers. Of course,
question lang.
Yes po.
David, question lang.
Yes,
Kasi
Senator.
napansin ko, lahat nung specialty nyo, parang yung Vicente Soto, lagi siyang kasama dun sa specialty. Kakayanin pa ba nung location nila to be, parang lahat na lang nung, parang kasama siya dun sa lahat ng specialty centers. I know for a fact, space-wise, medyo maliit na yung lugar nila And if we develop them into specialty centers, kakayanin pa ba if there's a need to build a facility?
Tama po kayo, Senator Binay. Actually, Vicente Soto as of now is our biggest government hospital doon. We're now on the way of developing all the other hospitals. But as for now po, siya po talaga yung pinaka-mature doon to hold the specialty centers. They also have plans for expansion po, but it hasn't materialized. We're supposed to be transferring our regional office, which is in the same compound as the hospital, so that they can expand, pero that has not materialized in the past 3 years po.
And I mean, obviously, although it would be easier if talagang adjacent ang facilities, with the specialty, with the doctors who specialize in various areas, kaya naman pa rin naman na i-move lang yung area even hindi adjacent, di ba? That's still an option, right?
Yes po. Yes.
I think yun naman, same naman kami ng concern ni Senator Nancy. Kasi all I know is, and one of the questions I meant to ask is, what is the difference between building on what is already existing? Like, yun nga, si Vicente Soto is very well established. They have all their professionals there. So, I suppose it is parang a no-brainer ba na dun ka na mag-invest? Kasi parang, nag-level up lang sila, di ba? The more patients they have, they just keep improving as opposed to starting fresh something else. I think that's the benefit of going Vicente Soto. But the question of Senator Nancy will help us also help you prioritize those plans na sabi nyo hindi nga natutuloy. Hindi tuloy na yan, di ba? Kasi nga, paano papagsisiksikan yan?
And siguro sa NPA, for example, kasi yung Vicente Soto pa lang yung nabivisit ko among these 4 hospitals. Would this mean na may mga services kayo dun sa hospital na yon na kailangan i-shift nyo to another hospital? For example, yung, I know for a fact, yung sa, ano nila, yung kung saan ka manganganak, to a bed pa dito sa Vicente Soto. Would that mean na, I mean, doon nakita na natin na may pagkukulang sa hospital beds eh. Yung ganong ano ba, service would be transferred to another hospital or may ganong plan ba na talaga magpo-focus na lang sila for specialty care?
Yes, Senator. Eventually, dapat po ganon. All level 1 and level 2 care patients should be shifted to level 1 and level 2 hospital so that they can focus on their specialty functions. Hindi naman po siguro 100% na ganon. Pero sana po 20% na lang yung mga cases na ganon and 80% yung mga level 3 cases and yung specialty cases po. Pero we still need to build din po yung ating level 1 and level 2 hospitals.
And kasama yon, because I think dapat makita din namin na since itong Vicente Soto magle-level up na siya, may kasabay ba siya na development na level 1 and 2? Kasi I guess we also have to fund that.
Yes, Senator. Nandun po sa ating Philippine Health Facility Development Plan, the expansion of the beds and capacity of our level 1 and level 2 hospitals po.
If Senator Binay will allow, Madam Chair, yun nga itatanong ko, ano na nangyari dun sa PHFDP, yung 2017 to 2022? Kasi it's supposed to address and rationalize all these gaps. Napakadaming piecemeal legislation. Ano na nangyari doon? So itatanong ko nga, follow up on Senator Nancy from levels 1 upwards, talaga bang nabuo na natin lahat yan? Polytechnic, polyclinic, hospital, barangay health units, all that stuff. The health stations to the RHUs. Meron na bang progress report dyan? Kasi that's supposed to end by 2022, di ba?
Thank you for the question, Senator Amy Marcos. We still have a long way to go po.
Kaya nga ambisyoso yung planong yun eh.
So itong Philippine Health Facility Development Plan tries to organize it on a priority basis. Ito pong PHFDP,
Pero
Philippine
may progress report na po kayo, Yusek?
is until 2040. Meron po, although yes po, we can give.
Okay, sige. Abangan na lang namin kasi napakadami nating efforts. Sana ma-rationalize para maintindihan natin yung big picture.
Yes. Senator, pero this is from previous Philippine Health Facility Development Plans, yung aming status report. Ito po kasing bago po itong ating Philippine Health Facility Development
Hindi siya
Plan.
masyadong bago 2017.
2040 po ito. 20
The announcement of the DOH in media and also the report submitted pag nagba-budget hearing is nasa 2017 to 2022 na po kayo.
Yung 2017 po was the approved Philippine Health Facility Development Plan by President Duterte. But with this one is a new plan po that organizes it based on priority. So ito po is starting only mga 2022
referring to another plan, that's not the Health Facility Development Plan.
Pareho po, Senator. Philippine Health Facility Development Plan, we just upgraded that 2017 plan po. So this is the one that's now ensuing for 2022 until 2040.
Siguro, Madam Chair, humingi tayo ng mga updated progress report kasi napakarami palang plan, ina-amend, hindi natin alam Baka sumobrang dami na.
Yeah, for sure. That's actually what we were discussing earlier na yung plans.
Yes, sorry, I'm late.
Kumbaga nakapako na yon na parang best case scenario, worst case scenario, hindi yung kada admin i-reinvent, di ba? They can take off from where they are and either go all out or not because at the end of the day, it's driven by the the policy that the executive will ask for, and then we just do our best to support. Sige, so we can do that naman in the next hearing kasi we'll try to consolidate all of this.
And then if there are amendments that you have made to make it more responsive to COVID and the other health issues that have arisen, para alam namin na nag-evolve siya.
Okay?
Yes,
Is
po.
it?
So this is just, thank you, Senator. So this is just an example of the costs. If we talk about the 4 specialty centers po, a lot of the cost on the 2022, 13.5 billion, and the succeeding years, yung mga cost din po. Next slide. Next slide, please. So last slide na po ito. So yung recommendations po namin is to, since we already have a Philippine Health Facility Development Plan that's updated to include a more organized way of developing facilities in the country, we propose po to consolidate the bills pertaining to expansion and establishment of specialty health facilities into one comprehensive bill. And also if we could have some help po in the institutionalization of the Philippine Health Facility Development Plan as a guide towards access to quality care for all Filipinos. Something like po, some of your bills mention preferential funding, like preferential procurement procedures, pero baka pwede hong mayowa for 3 to 5 years if they are found in the Philippine Health Facility Development Plan. Mga ganun lang po, Senators. Thank you very much po for your attention.
Okay, thank you very much, Yusek. So just to let you know of the flow, everyone, I will now give the floor to NEDA, and then after NEDA, DPWH. Statement lang naman of support ito, no? Kasi DOH naman, it's really a DOH thing. And then we will listen to other agencies and mga specialty hospitals. So I'll give a few guidelines later when we get to that point. So NEDA, please go ahead, and then after that, DPWH, please be ready. So NEDA, is it ASEC Roderick Planta?
Yes po, Senator Pia.
Okay.
Good afternoon po, Senators Binay and Senator Marcos. Then, the usual preamble po, Madam Chair, we've seen the Philippine Health Facilities Development Plan and also po yung UHC. At consistent naman po ito dun sa ating Ambition 2040. Sa totoo po nito, in fact, yung some of the strategies here are already reflected in the updated Philippine Development Plan. So right now, but not to preempt our principal, si Sec. Carl Chua, the technical team po ng NEDA is finds merit po dito po sa mga bills natin, and we look forward po dun sa succeeding meetings for the consolidation. We're very excited po dun sa discussion, the Health Infra Priority Plan, and also po yung Human Resource Support and also yung appeal po rin ng ating teammates from DOH for yung preferential financing po kung maaari lang po. Actually po, ito rin po ay na-present na rin po sa Social Development Committee of the NEDA Board. Yun lang po, Madam Chair. Salamat po.
Okay, thank you. Senator Amy, you have a question?
Yes, I'm not sure if this is the appropriate time to bring it up, but a primary concern of ours was the effect of the Mandanas ruling next year, because that's what we're budgeting for in the upcoming hearings. And is the DOH going to assist our LGUs given the divvying up of resources? Considering that many of our third, fourth, and fifth class municipalities have no way of handling the health concerns of their constituents as evidenced by the pandemic, ano? So, dun sa draft na ginawa ng DILG, di masyadong na-address yung health issues, kung paano i-manage yan ng mga LGU pagkat napakaliliit at talaga namang hindi masyadong kakayanin. I think alternately, Madam Chair, it will also diminish the resources available for specialty hospitals and other infra Dahil
Yeah.
mapupunta sa LGU eh.
Yeah, maybe I can just ask DOH to give a quick response to that kasi I don't
Next time na lang, oo.
just a quick response because it's a very valid question. Because I'd like to have this discussion with DBM and the finance team here
Tama.
also, di ba? Kasi
Oo.
you're very correct, no? These national centers, it would seem would be nationally funded, di ba? So to what extent will the LGUs take over? Have you had those discussions, ASEC? And yun nga, to that extent, I don't know, the finance team, we have kasi with us DBM naman, I don't know, DBM is invited, I just don't know kung nandito yung tao. So quick response muna and then let's just be sure that we have the right people to answer this correctly, Senator Aimee, if beyond her answer.
Thank you. Yes.
Yes, Senator. So, the Philippine Health Facility Development Plan prioritizes all LGUs by 4 quadrants po. So, yung priority funding goes to with those with low capacity, high gap, and low capacity and some gap po. In the DBM circular po for the funding for 2022, they asked all agencies, I think po, not to prioritize funding for, I think, 5th and 6th class LGUs po.
Sorry, not to prioritize or to prioritize?
Kasi not to prioritize. Ay, hindi. Sorry po. Mali po ako.
Parang baliktad.
Baliktad po. Sorry po. So, not to prioritize funding for 1st, 2nd, 3rd, and 4th class LGUs po. So, yung priority funding will only go to 5th and 6th because of the Mandanas ruling po.
Yeah, but that if you ask me, that is relevant to your basic health facilities. Pero itong specialty facilities that we're talking to, they will be located in the cities. So paano yung funding no? Did I miss the response on that one?
The specialty centers po are mostly DOH facilities. So we put full funding on this po, Senator.
Okay. So that's where I need you to sit down with DBM and whoever to ensure based on that. So in the next hearing, you can discuss with me. I don't know if DBM is ready kasi wala ka pang pinapakita na figures. Diba? Sabi mo, you're rolling that out this year and next year. O paano next year nga na mabawasan nga yung pondo nyo because of Mandana? So kindly figure that out so that when you present to us, maayos.
Oo, tama po. Kasi, Chair, alam naman ninyo kung gaano kasakit ng ulo yung devolution, yung unang devolution ng public health to the LGUs. Pati yung mga titulo ng ospital, nagkawalaan, magulo lahat eh. So, sana maisaayos ito ng mas mabuti given that we've had a rather dismal example in the past. Sana we can improve naman and learn from that experience. Thank you.
Okay, so after NEDA, thank you, ASEC. We'll call on Director Aris Doroy for DPWH statement. And then after that, be ready, CTBM is next.
Good afternoon, Madam Chair, Senator Pia, Senator Mensigunay, Senator Marcos, and the rest. On behalf of DPWH, allow me to present the consolidated status as of April 12 with regards to the various leading initiative activities in addressing the COVID crisis.
Choppy, di ba?
Yeah. Napasa na kaya.
Boss, magtanggal kayo ng break.
Inamin ko, ako I cannot understand. Your voice is muffled and then choppy pa.
Yeah, inayos lang ma'am yung presentation.
Will it take a few minutes? Kasi I can call on DBM first.
Okay na ma'am.
Okay, go ahead.
Next slide, please. So this is just a summary of funding releases for various health facilities. So under phase 1, we have a total number of facilities, 128, that will cater 7,425 bed capacities, the total amount of 1.6 million. This is the 6 facilities sponsored by various private entities. So,
Director, sorry just in the interest of time kasi, hindi ito yung focus ng hearing ko, no? So, it's interesting info, but I need you to move forward on the bills kasi are build on specialty centers eh. So,
yeah.
parang for info na lang to, pero don't go into details, please.
Yes, sa total na lang ma'am, sa total, okay. Just for now, we have a total program of health facilities, 816. That will get them 27,000 plus bed capacities, a total of 5.2 billion pesos. So as of today, we have completed 653. And of course, that can cater 24,117. So for now, next please. So this is just a sample, ma'am, for your appreciation.
Director, wag na yan please. Wala na tayong pinag-usapan kundi COVID. Minsan lang mapag-usapan yung hindi COVID related. Move forward please. I don't have time for this right now.
Yeah, sorry ma'am.
Thank you for the pictures. Magaganda yung pictures. So sige na, move forward na tayo.
Yeah, our presentation ma'am is just about COVID only.
Hindi ho COVID ang hearing. Baka naman COVID.
Yeah. This is all about health facilities, ma'am, with regards to COVID. Madam Chair. So we just presented this focusing on modular hospital that will be utilized by just to augment the existing bed capacities of our hospitals.
If you're going to show facilities that are serve as health facilities, okay. Pero kung mga quarantine center, sa ngayon, hindi yan priority ng hearing na ito.
Yeah, for this is a modular hospital, Madam Chair. Just for the quickest information. So, the LCP, we have just completed the ICU modular hospital that can cater 16 bed capacity. So, that was already turned over November 11, 2020. So that is inside the compound of the LCP. Next please. So again, this is another modular hospital from QI that consists of 4 typical design modular hospital and 1 ICU type modular hospital. So this would cater 110 bed capacity. So this was already turned over April 6, 2021 and managed and operated by the Jose Reyes Memorial Medical Center. So another one is from Jose Rodriguez Memorial Hospital in Caloocan, in Tala. So this consists also of 1 modular hospital that can cater 22 bed capacity, and that was already turned over March 9, 2021. So then we have this modular hemo facility at National Kidney and Transplant Institute. So this has its 20 seat capacity that can serve 60 patients a day. And the target completion is April 30, 2021.
Bukas.
Yeah, and this is targeted to be turned over on May 3, next week. Yeah.
I have a question, Director. Itong mga pinakita mong mga modular, I like them, no? They look good. They look good. But I have 2 questions. Number 1, how long did it take you to put those up? And number 2, are they easily convertible to regular? Well, you said it's a modular hospital, so maybe it's DOH who will answer this. Na it will serve the function as any basic health facility, level 1, paano ba? So yung first question lang sa'yo, how long did it take?
45 to 2 months to 60 days.
Ano yung lifespan nito? Because it was fast na babawasan ba ang longevity nito, or it's good for 50 years, 100 years, or what?
Number of years, madam?
I mean, does it compromise on the yun nga, yung parang longevity niyan, like because it was built fast, is this meant to have a shorter lifespan?
Siguro, Madam Chair, ang tanong is, anong lifespan ng modular?
Yeah, yun nga. Ano yung lifespan ng modular? Yun, ang tanong.
Yeah, it's between 10 to 15 years.
What?
10 to 15 years.
10 to 15 years. Can you give me a cost? Do you have something like a cost-benefit analysis? Like, ang galing, di ba? Like, sorry, how many months did you say it took to build that? Did you answer that ba?
Yes. Yeah. How many months for
To build.
2 months? 2 months.
2 months. So, may cost-benefit analysis ba kayo? Kasi if it will last 10 to 15 years and it only takes 2 months, that's not bad at all, no? So, as opposed to something that will live, 100 years, but it costs times 5, di ba? May ganun ba kayong cost-benefit so we can understand? Kasi nakakatuwa naman. I think it says a lot for people's morale to know that kaya natin mag-build ng ganyan ng 2 months.
And Madam Chair, siguro just to add, lalo na sa probinsya na space is not a problem. Baka this is a viable alternative, di ba?
Yeah. So may ganun ba, Director? Do you have that, a cost benefit versus a what do you call that? A heavy-duty building?
Or no, we have cost benefit analysis for that.
Okay. Can you sit down with DOH, USEC, Lilibet, and come up with something to show us in the next hearing? Kasi when we support that, we want to know what we're supporting, di ba? The long term, or something that can be addressed yung 10 to 15 can be addressed in the year, di ba? Within the year, and then it will last naman for 10 to 15 months. I mean, I'm sure there's no one type of solution. It can be a combination, right?
Yes. Yes, Senator. DPWH is a very good partner, so we will be sitting down with them.
Madam Chair, in addition, the intention for this is as temporary because of the location. This is the one story and occupies in prime properties. So the basic concept is temporary facilities. Removable, meaning this is modular, can be removed.
Noted.
Yeah.
Okay. Anything else?
Excuse me, I'm Dr. Rose Liquete of National Kidney and Transplant Institute.
Yes, ma'am.
Yes, you were asking about this modular hemodialysis facility. This is actually just a temporary facility since we were able to get this lot. This was previously occupied by illegal parties, and then we were able to repossess it sometime September last year. And so because of the rise of the COVID before, and we were also looking forward into using a temporary facility because we have overflowing of dialysis facilities at the NKTI. So we decided to ask the help of IATF and the DPWH. So actually, they were the ones who constructed this and funded this one. It was not a fund from NKI. So it's for a 20-seat stations of dialysis that will cater to 60 patients a day. That is for 3 sessions a day. It can also expand to 3 to 4 sessions a day.
Okay. The way ko dyan is because it's modular and director said it moved. At some point in time, NKTI landmark there, you can build your high-rise long-term facility and that can be moved somewhere else. So at least maganda planning.
Sen Pia, since nandiyan na nga yung facility, di ba? Sana, kasi assuming ko yan, matapos na yung problema natin sa COVID by year-end, nandiyan na yung building since kulang pa tayo sa pondo, baka pwede pa siyang magamit after this COVID. May ganong planning ba? May ganong planning.
That's exactly what want the DOH along with the in the States, nandiyan po sa NKTI, but the others with various areas sa Tala, sa Lung Center. to tell us what those possible futures are, di ba? Na it would run its life there for 10 years or maybe 3 years para habang yung pondo ginagamit sa ibang lugar, go ahead and function for 3 years, but maybe after 3 years, tatanggalin yun at patatayuan na kayo na mas malaki. Whatever that is, I want it presented to us.
And siguro, Madam Chair, just to add, wala naman siguro yung option na pagtapos yung problema sa COVID, gigibain na itong building na to, di ba? Huwag naman
Yeah.
sana.
Ang intindi ko kay Director, it can be moved kasi it's modular. So,
Madam Chair,
yes.
Madam Chair, actually,
Can I?
Director Doroy muna. Because I mentioned Director Doroy, yes, you were saying it's modular. I said it's modular.
it is specified in the MOA that after the utilization, it will be transferred back to the village if they will not utilize anymore.
Okay. Oh. And then Director Rose.
Yes, thank you for that. Actually, that is a 5,000 square meter lot. And this temporary facility occupies only the 2,000. So we placed it in a way that it will not hamper our plan for another 5-story hemodialysis center.
Okay.
So that's the long term.
Yes.
But I hope this we can sustain this building also because we can use it also for other purposes in the future.
Well, that's where you also have a good design para ma-maximize nyo yung space nyo because you're in prime property in Quezon City, di ba? So, but nowadays, let's design naman something for the future, di ba? Kasi people expect yung mga katulad nyo na your patients are regular patients. Sana yung may space ma-allocate dyan for gardens, di ba? Hindi yung punong-puno lang ng building. Anyway, now's not the time to go into details. You gave us sufficient response. Thank you for that, Director Duroy and Ma'am Rose. So can I move on now? I will call on
Thank you, Madam Chair.
BPM. Sorry, Director Duroy, were you done?
Yeah. Actually, yeah. 2 slides na lang yung madam. Akala ko you are calling for the other group eh. May 2 slides na lang.
O sige, tapusin mo na please.
Actually, ma'am, ito yung ano ma'am, under the 5th batch. Ito yung sa lung center. So, it will be located doon sa parking area din. So, i-prime lot din siya. So, that is proposed also as a Modular Hospital. 5 units siya and it can accommodate 110 bed. At aside from that, may out of 5, 1 is for ICU type. So, this is just similar doon sa QI. Na 5 siya for ang design modular hospital and 1 ICU type hospital. Next question.
Okay.
Madam Chair, just one question. On the average, magkano yung cost ng isang typical modular hospital?
1 unit. More than 25 million. 25. That's complete.
25
Yeah.
million.
Complete with all the facilities and site development, includes also all
Pero
the
wala
pictures.
pang equipment yun. Wala pang equipment.
Mayroon, mayroon siyang may equipment dyan.
So technically,
Suction.
25 million all in.
Yeah, suction pipe, the manifold, the oxygen system, negative pressures. Yeah.
Okay, para we'll have an idea lang of the cost. So mga 25 million. Yun lang po. Thank you.
So this is the last one, located at Batangas Medical Center. Target completion also is 30s tomorrow, and this is already 100% completed. So 1 typical design modular hospital and 1 ICU. So it could accommodate 31 bed capacity. Aside from that, we have adjacent for this is a dormitory for all medical workers that will serve this hospital. That's all, Madam Chair. Thank you.
Okay, maraming salamat, Director Doroy. So, may I now call on Assistant Director Jean Abella of DBM. And then after that, we will hear from the various directors of the specialty areas, no? Sige, DBM muna.
Yes, ma'am. Good afternoon po. Good afternoon po, ma'am. Senator Pia, Senator Nancy. Good afternoon po. Actually, ma'am, we haven't yet submitted our position paper kasi kahapon lang namin na-receive yung several bills. So we were not able to prepare one for
Okay.
this hearing. Nevertheless, ma'am, we really we appreciate the intention at saka purpose ng ating mga bills. But then allow us to make some small comments lang ma'am.
Hindi, I don't want small comments because the buck stops with you. Pag hindi nyo pinondohan yan, useless lahat ng oras ko. So,
ma'am, related nga yun dyan, ma'am, sa aking comments lang, ma'am. Lang, ma'am. Short lang, ma'am.
O sige, because I'm prepared to give you more time No problem with that. I just really wanted to have this hearing kasi like I said, it's part of a series of hearings. So, if you cannot give us yet, no problem at all. Kung relevant naman yung mga small comments, okay. If not, you can save it for a more comprehensive. Kasi I'll really tell my staff to sit down with you. And,
sige, ma'am. If that would be the case, if you would allow us to submit na lang ang aming position paper, that will be fine with us, ma'am.
But before you submit the position paper, I will ask the USEC Lilibeth to sit down with you para clear tayo dun sa mga priorities, 'di ba? Para isang isang pasada na lang 'yan. Okay?
Ma'am, may I say something?
Yeah, of course.
Ma'am, actually naman, we really do support DOH. Ang problem lang kasi namin minsan kasi, ma'am, when we do make coordination, hindi kasi na ibibigay lahat ng mga supposedly mga supporting documents. So we are short of recommending.
Yeah.
So we cannot justify, ma'am
Yeah. Why don't I ask my staff and the staff of the chair, I am the acting chair now, to sit down together, di ba? Para lahat nung hinihingi nyo rin documents, I hope you were listening earlier so that you know already the general idea. You sit down together, tell them what those requirements are, and then we have a certain amount of time for them to give it. Otherwise, walang mangyayari sa atin. Okay?
Yes, ma'am. Kasi mag-start na tayo ng budget preparation for 2022.
Exactly. Sabi nga nila, kasama sa 2021 nila to. So, okay?
Okay, ma'am. Sige, ma'am. Thank you, ma'am.
Okay. So, ganito tayo next kasi in the interest of time, I'm not sure, my staff has not confirmed with me, but I have PHC, PLC, NKTI, PCMC, PMA, PHA, and PAPO, and so on and so forth. So, I just really want at this point a very quick statement on, your future plans, because I cannot go into details right now. So the idea really is to just put on record what your aspirations are for the next 10 to 20 years for your specialty. Okay?
Chair?
Yes, go ahead, Nancy.
Can they just also add dun sa presentation nila yung current manpower?
Yes,
they can provide, and what is the need?
Yes. Actually kasi, the first few that I will call are the heads of those specialty hospitals that we have. Hindi pa ito yung heads of the associations of those specialties, no? So, I was planning on having that as a separate hearing dun sa ating human health resource. Nevertheless, obviously, these directors of these specialty centers would also have an idea na hirap ba sila, di ba, to cope with the demands. But to assure you that in the next hearing on human health resource, we will get the associations kasi I really thought of dividing it up para medyo focus tayo on the infra part and the special So, but to let you know that we will address your concern if they cannot give us as much. Well, I already assume that we will have to listen to the associations din naman. Okay? So, Dr. Joel Abanilla of Philippine Heart Center, and then after that, I will call on Philippine Lung Center. So, sir, just a few minutes to just express your. Thank you.
Just 3 minutes. Well, it's known to all that cardiovascular diseases is the #1 killer in the country. It accounts for about 160,000 annually, whereas COVID death is only 23,000. This is 160,000 annually. So the Philippine Heart Center has been in existence for since the time founded by Marcos, no, and the mission there was be one Filipino left unattended for, then our mission is not accomplished. So we incorporated that in our mission as well, that we will bring cardiovascular care to all. Okay, and the Philippine Heart Center has been at the forefront. But we know too well the Philippines is an archipelago. The access from the provinces is horrendous. Okay, so even before DOH came up with the idea of the satellite program, as early as 2011, we were already thinking of the creating the satellite programs. So it started like in 2015 when we already went to go ahead with the surgical mission with the hope of bringing the technology and treatment to the province. And then 2019, it was formalized by DOH. No? They created a technical working group so that this expansion program of satellite will be started and given impetus. So from henceforth, right now, we have 5 regional centers already that are more or less working, and the remaining about 17 are still in the process of completing their facility. We've heard initially how USEC subdivided the satellites programs into basic, and then we have the complex and the national. The determining factors actually there is the facilities of each. So the more the facilities there are, the more complicated cases that you can do. Now, we have, as I've mentioned, created already an maturity assessment of how the program will go henceforth up to the target date of 2022. But then we extended it to 2025. So in each category, there are requirements how a center can become a regional or a satellite center. No, the number of thoracic cardiovascular surgeons, the number of cardiologists, the critical care nurses, and the perfusionists, and all those that are required to create a satellite. Okay, now real world problem in the Philippines is that I have been fortunately been a president also of the Philippine Heart Association. Despite the many graduates that we have each year, 80% of the cardiologists conglomerate here in Metro Manila, and they leave the number one thing in the province. So they don't want to go there. There is no facility to use. Anong gawin nila doon? No, only the ECG. So they so the problem of the satellite is to disperse the technology as well as the art of treatment, at the same time to disperse also the cardiologists and the surgeons by providing a place to practice. So there are challenges, but we have started and we have seen it to fruition. As of now, we have PCMC, we have the Vicente Soto, we have the West Visayas Medical Center, we have the Bicol Regional Center, all already starting doing cardiac surgery. The simplest may be some simple congenital correction or bypass. No, so they started doing that. The more complex and complicated ones, they still bring it to us. So now we are so happy that nakisawsaw yung DOH. Now, because to do this, we need funding. It used to be when we started, we have to get sponsors for the airfare, Philippine Airlines. We have foundations to help us support, and our meager budget, to bring our team to the region. So why should we do this by ourselves. We need the help of the national so that we can make this happen. So, and then we foresee that na nagawa pala sa 5, so pwede in each region. Why? Also, each of them have a cath lab. You can do angiogram, no, to see the coronaries. To give you an idea of where we stand, no, when I was president, that was about 7 years or 8 years ago, we only have 11 cath lab in the entire Philippines with a population of 110 million. Malaysia, with only 38 million and one archipelago, have 110 cath labs. So that means if you have a heart attack anywhere else in Malaysia, you can go to a cardiovascular center. So that is relatively a high mountain to equalize, but we can have some semblance of having that care, having one in each region. And we find already, we did a study that the most practical is because they have the budget, they have the place, they have the setup, they have the manpower, are the regional hospitals. So katuwang. So helping out, since we are a training center here at the Philippine Heart Center, of course, these centers will not work without manpower. So ngayon, we have that lateral entry. No, na priority namin sila. The applicants may not be as good as some of the applicants in Metro Manila, but then since pumasa naman sa basic requirement and they signified the intention to go back to the regional hospital, so we accept them. So now that solves the problem also of dispersion. Not only that we create a facility for them, also we also welcome those who are in the area who will most likely practice in that region. So nakalatag na ito, no? How many manpower that they have, what they have, until 2022. But we have expanded that, extended that to 2025. So yeah, in summary, that's how the development of the satellite heart centers. So we were too happy when we saw Angara and you, Senator Cayetano, that to give attention to the specialty centers, because this will make also our job relatively lighter, in fact, achievable. Okay, with your initiative and the budget and the DOH helping us, it's not a far-fetched dream. I think unless you want to know more details. No?
Yeah.
So
Thank you. Thank you for that, Dr. Joel. I think, definitely what you said is very helpful to us. But I really want to be able to hear from everyone in the remaining few minutes that we have. No, so this is what I'll ask all of you to do, please, so I don't have to cut you off. 3 minutes, 5 minutes is not enough for us to understand the depth of your concerns and issues, no? Especially since we are not even doctors here. No, Senator Nancy and I were explaining that earlier. And so what I'd like to be able to do is number one, let's set the standard na all of you, if you can submit what your wish list versus what you feel are the minimum expansion plans that you need for your to grow, to provide your services to the vast majority of Filipinos. Minimum. So let's say if your minimum requirement is, like you said nga, in these regional hospitals, ito yung achieve ko. But you mentioned 2022 to 2025. I want you to have a 10-year, 20 and 30-year plan so that we can really see that. Kasi nga, like I said, futures thinking is my, my area of interest. And I want to see that. No, I don't expect it now, but if you can submit that so that we can start studying that, that is the goal, no? So for the next speakers, I'm sure all of you will basically reiterate a similar statement as Dr. Joel kasi, no, na ito yung function, no need talaga siguro at this point to go into details kasi nga hindi rin namin nagagrasp yun. Sorry, hindi kami doktor. Pero more important is the data you will submit to support that, because I need it to be data-driven. I will go back to DOH and say, ano ba yung top natin, 'di ba? Top priority natin, not because there's a passionate champion like any one of you, but because the evidence shows that ito yung ikinamamatay ng mga Pilipino, ito yung bibigat ng bulsa nila, and this is what we can do to solve it. Okay, and then may I also request that you tie that into the preventive cases. Like if you will tell me, Doc, again, I do not know. If you tell me, sadly, 80% is genetic, wala naman tayong magagawa. Di wala. So what do we do with the 20? Diba? So that's what or you tell me, hindi, meron, but we'll now have to go into studying the genes or whatever. That's what we want to know. Okay? That
Madam
can happen
Chair?
in the future discussions. Yes,
Yeah.
Senator
Siguro
Nancy.
just additional lalo na dito sa problem natin sa puso. Kasi di ba with COVID, parang nagkakaroon ng long-term, parang lumalabas ngayon may mga inaatake na COVID-related because apparently having COVID parang mas naging prone sila to heart attack, to stroke. Baka magandang i-incorporate din nila yan because that is a potential problem in the future, right? Kasi yung mga almost 1 million yung nagkaroon ng COVID and hindi natin alam kung ilan doon yung magkakaroon ng complications sa heart. So maybe we can also include that in their submission.
Agree, and to the extent that in my other, not hearings, but discussions, yung ating understanding and preparation for zoonotic infections or diseases, kung relevant yan sa specialty nyo, di sabihin nyo na rin. Kasi like, I wouldn't know, di ba? I only learned the term zoonotic a few months ago. So knowing that apparently that there is a big chance that there will be more coming in the next years, how does that affect your specialization? Okay? So let's move forward. Sen Nancy, can I ask for a favor? I need a bathroom break. Pero kasi this will be put on record naman, so tuloy-tuloy lang sana tayo. I'll call on Dr. Vincent Balanag for Philippine Lung Center. And then after that, NKTI. But I'll be back before that naman. So please take over lang. And then Dr. Balanag, please.
Yes, I'm here.
Go ahead.
Thank you, Madam Chair, Senator Binay, for this opportunity. Well, for the Lung Center, we fully support the Philippine Health Facilities Development Program of the Department of Health, Lung Center being an attached agency of the Department of Health. Well, the question initially was why Lung Center as the National Specialty Center? Well, that is really our mandate, no? That's based on why we were established through presidential decree. So I think it is only proper that we be considered the apex hospital for lung care services. We have really planned for expansion of the lung center itself, no? Right now we are 250 bed capacity, although we're not using it fully because of COVID. No, we're down to about 150 because of COVID. But we need to expand for an additional 250 beds for us to be able to provide the full set of specialized services like lung transplant, robotic surgery, all those specialized services that we can offer. So actually, we have already a plan for a 250 bed expansion worth 1.5 million in terms of infrastructure and another 1.5 billion for equipment. So this we hope to be finished in 2025. Now regarding the plan of the DOH, definitely we fully support it. We are actually already in the initial stages of developing the region, subnational and regional lung centers, particularly Bicol Regional Training, Vicente Soto, and Southern Philippines Medical Center. No? The choice really of this as subnational or regional depends really on their level of capacity of delivering certain services, pulmonary services. So these were chosen primarily because they have a higher level of pulmonary service that they are already providing to their to their areas. No, so for us, it's really adding infrastructure, the needed infrastructure and equipment. But the most important really is the human resource, kasi we cannot deliver pulmonary care without the human resource, and that is where lung center is primarily focused. No, so ideally, comprehensive or basic facility should have a, of course, pulmonologist, thoracic surgeon, thoracic anesthesiologist, anatomic pathologist, and interventional radiologist, medical oncologist, for the center to be able to provide the whole range of services. So we have a lot of pulmonologists throughout the country, so that's a good start. But we definitely lack thoracic surgeons, anatomic pathologists good in pulmonary pathology, and we need a lot of radiologists, primarily for radiotherapy of lung cancer, and as well as other cancers that can be treated with radiation. No? So basically, these are the areas where we want to help training pulmonologists, thoracic surgeons, pathologists, radiologists, and usually it's the local hospitals which choose who to send to us for their training. No, usually these are already medical specialists with basic specialty like internal medicine or general radiology or general surgery who want to subspecialize. So we want to train them so that they be able to do the more specialized services like lung resection or video assisted thoracic surgery, and all the radiologic procedures, interventional procedures, as well as radiotherapy techniques. No, so that is really what we want to build up in the regional hospitals. But at the same time, we are also very cognizant of the need for preventive and promotive services, not only of course in the tertiary, but most especially for the primary care. Kasi like for example, TB, asthma, COPD are very much preventable, and there are already established ways to prevent this. No, so actually we are also contributing to what should be a ideal primary care service for lung care in the barangay health stations or the rural. So for example, spirometry, which is a very important tool for diagnosing asthma or COPD, should already be present in the barangay health stations or the rural health units for be able to diagnose asthma and COPD and other obstructive lung diseases at the primary level. And only when they can be treated immediately by primary care specialists or internists, but when they need more specialized services for rare and complicated diseases, then they can initially send them to the regional hospitals, and if they are not able to provide the service, then they can refer eventually to the Lung Center of the Philippines. So that's how we want to envision our role in the network of lung care services. So, of course, the Department of Health will provide the funding just for the infrastructure, the equipment necessary to provide the different services under pulmonary care. And of course, Lung Center will also benefit by getting also funding for infrastructure for our expansion, as well as getting more sophisticated equipment and services. And our goal really is to be able to do a lung transplant, because we haven't done lung transplant locally, and hopefully we're hoping that within 1 or 2 years we'll be able to do several lung transplants. So I think that's basically how we were looking at things. Thank you very much.
Okay, thank you very much for that, Doc Balanag. I just want to make quick comments. No, kindly also you were saying about the shortages in some areas. Maybe you can also point out in a written report what are the low-lying fruits here, no? Ano dyan yung madaling ma-address? Like, I don't know if increasing our medtech or radio technologists would assist in some areas kasi they would be able to help the few radiologists that are available. Hindi ko na alam yon. So it's up to you to pinpoint what are those low-lying fruits. And then that goes with all the other hospitals who will be, the directors who will be speaking here, no? And the other thing I wanted to point out, thank you for mentioning prevention, but case in point, no, I handled very contentious hearings on syntax and the consumption of cigarette and vaping products. So I post this to you, and again, the organizations are not here, so I will mention this again in the future hearings. That I would like to ask for there to be a bigger participation on this, because a lot of these issues are involved in lifestyle, diba? So yes, you are the specialist, pero we already know that we cannot keep up with that demand anyway. So hindi naman kayo mawawalan ng trabaho. That's not the issue. And so let's make it more efficient if most of the cases would be, if you can have less cases because we've done a better job on prevention. So yun lang, offhand kasi I don't really recall that there were that many specialists who joined in this campaign on the prevention. And I'd really like to be able to see that. I know you have your hands full, but down the road, that's where these advocacy groups connected to you can come in para nag-guide nyo din sila. I'll leave it at that, no? My statements are really applied to everyone, all the specialties. They're just takeaways from some of the statements that the resource persons make. Thank you for that, Dr. Balanag. So let me give the floor again to Dr. Rose Liquete of NKTI. Yeah. Can we, concerned lang of the time.
Yes.
Medyo marami magsasalita.
Yeah, I just I sent a slide presentation, very short. Yeah, please, Sir Mike, please. Yes. So, well, everybody knows about the National Kidney and Transplant Institute. It's a lead center for organ transplantation. And it used to be 383 bed capacity, but now because of the COVID, we're only like 279 due to distancing. And now we have closed several units just to augment our emergency room. Next slide, please. Yeah, as you can see, the burden of the disease. By 2022, maybe we will have 100,000 or even more patients with end-stage renal disease. That means they are needing dialysis, these patients. And our dialysis centers have now, is now like more than 1,000, no? And most of these are at the NCR, and then the region 4A and 3. So which means nandoon ang napakaraming kidney problem and on dialysis. Next slide, please. Sir, next. Okay. There are 33 accredited transplant centers in the Philippines and 56 transplant surgeons. But most of these centers are in the NCR. And the rest, region 3, 4, 6, 3, region 1. So it's spread all over the Philippines, but mostly in the NCR. Next, please. And of course, the urologists, they are mostly also in the NCR. Next slide. The transplant anesthesiologists, they are also centered in the NCR. We have 14 here. These are not just anesthesiologists, they have training in transplant anesthesia. Next slide. And adult nephrologists, we have 627. So as you see, we have more than 1,000 hemodialysis or dialysis centers, but only more than 600 nephrologists manning them. Next slide. We also have pediatric nephrologists in the region. Okay, the 4 pillars of a transplant program, we have the transplant surgeon, the urologist who should know how to do a donor nephrectomy, the nephrologist, and the transplant anesthesiologist. Of course, others, we need the nurses. Not just nurses in this specialty center, but of course, those who are in the ICU, the OR, the clinical nurses, the transplant coordinators. We have others in the ethics committee, of course, the social service, and our ancillary services. Next slide. Adjunct, this is the minimum requirement for a transplant program. You should have an Doppler ultrasound, the radionuclide scan, that's in the nuclear medicine, the CT scan, which is capable of CT angiography, and of course, your routine x-rays. What's more important in a transplant program is your immunology laboratory. You should be able to do the HLA tissue typing lab, which will cost probably now 20 million or more, and the therapeutic drug monitoring of the anti-rejection medicines. For now, only the NKTI has this immunology and the therapeutic drug monitoring. Of course, the private hospitals, St. Luke's, PGH has the tissue typing. But in the provinces, the rest of the provinces, they don't have it. We were trying to capacitate SPMC and, of course, Vicente Soto. They are in Visayas and Mindanao. But then it's hard to get an immunology who will train in tissue typing and also medtechs to train in the therapeutic drug monitoring. So it will cost like 20 to set up a tissue typing lab, 20 million. I wish we could have it in Mindanao and Visayas so they don't have to send the specimen to Manila. And then the organ transporter, yes.
I need to interrupt you. And this is for the future centers. Nabanggit namin ni Senator Nancy. We're not doctors, no? So I have to tell you, my capacity to retain that information is very low. I have to be honest with you. So, ma'am, it is more effective for me that you send that in writing and that you just tell us simply that the goal is to have this infrastructure and the equipment and the personnel, and which one will cost more. And, because ma'am, hindi ko talaga mariretain yung info na yan. Hindi, it's like me talking to you about legal terms, no? So I don't want to waste your time, and I also want to be able to absorb what I am capable of absorbing, okay? So you can put that in writing with numbers because si DBM will determine this for us, not us, no? So kahit ma'am sabihin nyo yung mga binanggit nyo, it's lost to me already even though I was really concentrating. Okay? So you'll have to summarize.
Yeah.
In terms of
summary, actually, it's just the 2 slides.
Personnel,
okay.
and then submit it in detail.
Yes. So these are the infrastructure, of course. The center should be in strategic locations, I have mentioned. And these bills, or soon to be laws, shall put teeth into its implementation. The medical center chief should be mandated to support this program. But of course, NKTI shall assist the identification of these regional centers and support capacitate these hospitals. And the manpower, we have been having these homegrown specialists so that they will go back to their provinces. Unfortunately, as mentioned, they do not go back to their provinces. Next slide. So how to capacitate this, how to increase our manpower, to capacitate these hospitals to be transplant program, to have transplant programs. We have all this training. We have presented this already to the Department of Health so that we can augment the specialty centers especially in the provinces. So next slide. I'll not go through it. And then the training of the nurses. They're not just the nursing care. They have to be well-versed on basic nephrology and peritoneal dialysis and hemodialysis because these are all the bridge towards transplantation. Next slide. So we have the satellite centers.
Madam Chair.
Yes, go ahead, Senator Nancy.
Yes, question lang kasi di ba parang nabanggit niyo dun sa nurses, parang may kailangan siyang additional skill. Would this entail additional pay?
the salary is according to the salary grade, but it's an additional competency for them to handle renal patients, dialysis patients, because it's different in dialysis,
Ma'am,
hemodialysis, or
So
PD.
the question is simply, we want to ensure that when we demand of them more skills, that there's commensurate increase in their, otherwise aalis lang din yun. So yung question ni Senator Nancy goes into our health human resource management. So is your answer na wala?
Wala, because it depends on the salary grade.
Kaya nga ma'am, so sa salary grade, ilang differentiation yung mga binanggit nyo na may specialty. Kasi if not, then we have to go back to DBM and DOH who sets those salary grades, I imagine, to see what they can do about it. That's the point. Kasi otherwise, pride na lang yun, di ba? Pero how many people can feed their family on pride? Right?
Mhm.
Right?
Yes, I think that's very important. Increase the salary of the nurses in the critical care.
So what we need to do, like I said, ang takeaway namin, ikaw, Senator Nancy, may naalala ka dun sa mga different specialization ng mga nurses. Wala ho kaming, ako walang capacity na matandaan ko yon because I'm not even familiar with the terms. But noted ko na yung general issue that these are the kind of nurses that you need, very highly skilled, and then with Senator Nancy's intervention, we want to ensure that they are sufficiently, well, if not sufficiently compensated, better compensated. So we will take note of that. I'm also asking the Secretariat and my team to take note of that. And for all the specializations, ano yung mga specialty skills ng nurses doon? Like 5 klase ba? 10 klase ba? Sa isang ospital, 10 ba yung ganun nyo? 20, 30? Yun yung gusto natin malaman para actually sa totoo lang, gagawin din kayong training ground ng abroad eh. Once na matrain yan, kukunin din naman sila eh. And that's why I've always been a supporter na rin lang of negotiating on a wide scale yung human resource natin. Kasi otherwise, wala tayong napapala. Eh kung magiging training ka rin lang, tatanggalin din sa'yo, eh di might as well mag-donate yung mga bansang yan ng ating training facilities. That's what they do in other countries. Anyway, so like I said,
Abroad, if they apply abroad and they are asked, in what hospital are you working? NKTI, oh, you do transplant. Okay, check,
Exactly.
They're easily
What
taken
I'm
care.
saying. And so that's why you can identify these countries who are poaching on our human resource anyway. And we might as well negotiate with them, which is being done anyway in other countries. I've had this hearing in 2004 na to negotiate so that we might as well get something out of it because they're just taking advantage of the training that you give our nurses. But hindi mo naman mapipigilan yung nurses umalis kasi karapatan naman nila to travel, di ba? That is their right. We cannot stop them. But what do we gain from it? Sana we will negotiate better with others. Nanganganak itong hearing na to. That's why bear with me that I need to cut it and because I have to park that in another issue. But very, very well taken. Comment mo sa Nancy and yung response. Sige ma'am,
Okay,
kasi
mabilis na lang. So these are
tayo sa time.
These are the centers that need to be where we can have our regional kidney centers. Next slide. You mentioned among the bills, it's there, mga build ninyo that you have introduced. So we have several renovations already inside the hospital so that we can increase our bed. And then proposed buildings here. We have the proposed dialysis, which can we can have more than 200 dialysis stations. That's the upcoming.
Pero question ko is, di ba other centers can handle dialysis na? Is that really a good use of your space given the high level of competence you have in that one building?
Yes, I believe so. Most especially, the NCR is a big area, and we have most of the patients who come here from the NCR. The rest are in region 3 and 4.
I'm asking to consider if your talent, that's your team, the resources you have to better use beyond dialysis lang. Kasi from what I know, ang daming nagda-dialysis. Hindi ba mas maganda? Again, I'm not the expert. I'm just posing the question. Hindi ba possible na yung dialysis, simple dialysis, sa ibang area, instead of nag-expand kayo ng dialysis, should you not be focusing on other interventions, mga operations, mga transplants, and whatnot? Just a thought.
To increase transplantation. It's just there are so many problems inherent in transplantation also because you need a donor in order to have a transplant. So that's one. For living donation, it's really very difficult, no, for the families to donate. We are also in our part of the program of NKTI also is our organ donation. So the deceased organ donation that we promote also.
I'm very interested in organ donation. My brother is liver to our father, recipient. So I'm quite familiar. Pero my question naman was simple lang na I'm just curious why the need to expand on dialysis when that is a low level activity from my limited understanding. Bakit kayo na specialty nyo, kumbaga sa ospital, panganakan, ang dialysis parang ganun din, di ba? Simple. So bakit kayo nagfo-focus niyan, nag-expand kayo dyan? Can't hear you, ma'am.
End-stage renal disease. You know, now it's more of hypertension and diabetes. And that is the focused clientele already because most of these patients, may longevity na tayo sa life natin, di ba? That's why most of our patients now are diabetic and hypertensive, and then they go into renal failure. And these are more on the elderly side. And some of them actually are not suitable for transplant because they already have other comorbidities, the heart.
So are you saying that the dialysis patients you handle are already the high-end cases? I'm just trying to make a distinction between levels of care needed because you being the number one kidney center of the Philippines, dapat nag-specialize kayo. So may distinction ho ba?
Yes. And of course, we have other programs. We have the preventive, right, renal disease control program also.
No, I'm just focusing kasi na nagsabi kayo magpapatagdag kayo ng dialysis. So, I was just wondering ba't doon kayo nagdadagdag? Kaya doon nanggagaling yung question ko. Kung dapat ba doon area of expansion nyo?
You know, we have our current dialysis stations now is only 62. So once this only 62, and we are already four sessions per station, and that's overworking our machine. So once this building is there, so we can move out our inpatient dialysis to that building, plus also our outpatient dialysis. So the inside of the building can be converted into rooms also.
Okay.
So that is our movement.
I'll leave my question there kasi somehow I am unable to understand like when you say you have your outpatient, why can't that be handled by other hospitals, by other other health centers? Why does it have to be NKTI? Pero ma'am, paulit-ulit, it's probably my lack of understanding. So let's just leave it at that and let's just have another discussion on it later kasi we need to move on na rin naman.
Okay, so that's why I mentioned there are more than 1,000 freestanding dialysis centers already. But these are mostly private centers. So only few government in the NCR. So that's
Kaya
why
ma'am, government, ang ano ko is bakit sa NKTI, 'di ba? Bakit hindi mas marami sa labas? Yun yung
Actually, Cynthia,
yes.
can I just share? Kasi like for example, sa Makati, may yung LGU minsan may tie-up na with a private dialysis center. Hindi ba pwedeng ma-explore yung ganon para mas ma-utilize yung facility ng NKTI na hindi lamang for dialysis. I think that's your point, right? Na instead of pang dialysis, baka we can add more for transplant or something. I think that's your point, right?
That is my point. That is my point exactly. Because I was thinking of that. Ang daming LGU na humihingi sa atin ng kidney, di ba, dialysis. Ang daming humihingi sa amin, ma'am. So parang sa akin, pwede pala nilang i-handle yon. And sabi nyo kulang, more of private, public pa rin. Under NKTI's guidance pa rin yan, yung kung saan siya pupunta. Pero tataka lang ako, bakit dyan kayo mag-expand mismo sa NKTI? Unless they are directly in need of the services of the specialty doctors because they have a transplant or sabi mo nga, may mga high blood yan, so nandun sila. Pero yung ibang cases, in my mind, again, in my limited non-medical mind, baka pwedeng nafa-farm out yun in the different cities. Kasi talagang meron naman yung ibang cities. But I don't want to belabor the point because we need to move on.
Okay.
Ma'am, can you wrap up?
Okay. Thank you for that. Well, I wish we could concentrate on transplant alone. But the thing is, transplant dialysis is a bridge to transplantation. So we take care of them also. So next slide, please. Next slide. Tatlo na lang yata. So these are our expansions and renovation. So we already have the peritoneal dialysis building and warehouse. Now again, you might ask, why do we have this one? Because there is also problem. Next slide, please. Next slide. That's the dialysis warehouse now. The reason why we have this, again, with partnership, private partnership ito, is because other centers, even from the provinces, do not have access to the peritoneal dialysis companies. So we have a lot of patients on Z package who get their PD, the PD water from NKTI under the Z package. And then there are no other centers, even in the provinces, who have C package for peritoneal dialysis. Next slide. So this is the medical arts building, the future medical arts building. Next slide. Next slide, please. And medical arts building so that we can move the doctors out of the main building. Next slide. And convert them to rooms again. So this is the hemodialysis services building. We have, as mentioned, we had a study on this, that it will be beneficial also to the people. It's a partnership also. Next slide. Next slide. So this is the area vacated by the illegal occupants. This is 5,000 square meters and already leveled. And that's where, next slide. Next slide. Next slide na. This is now as mentioned by DPWH, this is the temporary hemodialysis facility in the 2,000 square meters. Next slide. Okay, that's it. Thank you.
Thanks, ma'am. Thank you. Let's move on. We still have a lot of people. ECMC, Dr. Sonia Gonzalez. After that would be PMA. I try to give you all the time, but honestly, I'll have to start interrupting because we also have our time constraints, no? So I ask everyone to kindly, that's why my staff gives you a time limit to begin with. So kindly don't make my job so hard kasi ang hirap to keep interrupting, pero please follow the time given. PCMC, Dr. Sonia, and then be ready, Dr. Rhoda Goko.
Yes, good afternoon, Madam Chair, Senator Binay. PCMC is grateful that more specialty centers for pediatrics are being thought of, being connected or attached to regional centers, because we would want to emphasize always that the child is not a miniature adult and children have specialized needs and care. So let me just raise 3 points this afternoon. Number one is PCMC has already established its clinical pediatric subspecialty center. So that's subspecialty already including the different systems of the body. And also we have a perinatal center, which is very important for high-risk pregnant women. By the way, today is our 41st anniversary. And we are proud that we are giving service to our children. So now, PCMC is actually our authorized bed capacity is 200, but we have been approved to be a 500 bed capacity. And so we are preparing for this. We are awaiting the completion of our 8-story building, which is 70% complete by now. We have our internal restructuring program for our staff. So gradually, although hampered a little by COVID, we are filling in all the positions for the 500 bed capacity staffing. Number two, we have our training programs in place, no, for pediatric residency and more than 20 subspecialties. So we produce pediatricians with specialty and subspecialty training. So currently, our graduates are distributed all over the country, and we expect our graduates to lead in all the regions. So for the last 10 years, actually, from our graduates, 47% stay at the National Capital Region, 30% in the rest of Luzon. We have 10% going back to the Visayas, and at least 6% going back to Mindanao. Then we have around 7% going abroad. So we continue to produce trainees who are excellently trained, and they go back to their regions and lead there. No? So if we have specialty centers in the region, we are sure that our alumni will head these specialty centers. Now, we are not limited only to the training of doctors. We have opened our doors to the training of nurses because nurses for pediatrics should also be specialized, particularly in the intensive care unit or handling the neonates. So we accept trainees from different hospitals in different regions who would train with us for a couple of months. We open also to the allied healthcare, like the pharmacists, who come here to us also for training, particularly handling of our chemotherapy for our pediatric cancer patients. So it's not just limited to doctors. And then number three, in line with the universal healthcare, as mentioned by a while ago by Dr. David, regarding the PCMC as the National Specialty Center for Neonates, for the next, until 2025, we have already submitted to the DOH our plans for the neonatal center, and we will be submitting this also to you. So this would include our programs, the equipment needed, the facilities, and how we would help the other regions, the regional hospitals in this neonatal center. Because since we are the reference center, we produce modules and we provide training also and assistance to the rest of the hospitals identified to be referral centers for neonatal care. That's all, Madam Chair.
Thank you, Dr. Sonia, for coming close to the time limit. Just a quick response, takeaway ko sa statement mo, and I'm tying it into the statement of Dr. I think this was Dr. Joel pa earlier. When you mentioned the training of nurses, when I mentioned low-lying fruits nga, I mentioned the radiologists, no? And I wanted to point out, which is not new to you, I'm sure, diba? I'm sure so many of those in your professions are now doing online consultation. And in my committee on Sustainable Development Goals and Futures Thinking, we've had experts from all over the world testify that COVID has really accelerated online consultation in a way that it would have otherwise taken another 2 decades, because there's just that hesitancy to dive into that. So now with that window of acceptance, no, that window is open. I need each of you to explore how you can exploit that further by way of utilizing the professionals that have less number of years in training. In other words, the radio technologists who can then make use of technology and show this to the specialists back in Manila or Cebu to further provide the access to the same, well, close to the same services to most people. Because obviously, we cannot implement all of this, even though DOH said they will, but it's not going to happen for next year. So how do you then do that? So for example, for Heart Center, for PCMC, for NKTI, 3 out of the 5 areas that tinutulungan nyo na, mabuhusan natin ng pondo. Hindi lahat, 3. Pero dun sa iba naman, for a smaller amount of money, ma-upgrade natin yung technology nila, di ba? Malik sa inyo, matrain yung mga nurses doon, or I don't know, medical technologists, or for that matter, IT graduates na may dagdagan nyo lang ng konting medical understanding to make use of technology for these online consultations, di ba? You need to really explore that at pupukpukin ko kayo dyan because that naman is my exposure in my other committee on futures thinking. We need to make that effort to move in that direction, especially in a country like ours. No, na if you were listening early on, yung example na binigay ko na yung bundok na inakyat ko, there's no way na magiging accessible yun by 30 minutes or by 1 hour because from Baguio, it's a 1 hour drive to that town. And then from that barangay where I park my car, it's a 2-hour hike. So how will that happen? And that's even assuming that Baguio City has a certain level of sophistication yung ano nila, available na ano nila, right? So I think my point is clear, no? So I need that to be included in your presentations, okay? In your submissions to us. Okay? Sige,
Can I insert something lang, Senator
Sige,
Pia?
fast lang, Doc, please. Sige, go ahead.
We have actually started that already, pero hindi pa siya regular, no? Like the X-ray, i-relay nila. We can read it here in Manila. Also, right now, very commonly used sa cardiology, 2D echo. We call it tele 2D echo. They do it there on site. We can read it here in Manila.
Okay, that's good. That's good to know. But may I push the envelope further with all of you? Please try to explore that further. May I ask DOH to take the lead on just finding out kung, I don't know if there's somebody else, Yusek Lilibeth, another person, not you, baka hindi na to infra. How many are actually doing that, no? Because we want to know and I want to find the best practices. Please feel free to give that to us if you think that meron kayong i-share. Okay, before I move on to PMA, I'd like to finish muna yung ating mga medical center. So can I call on Dr. Gap Legaspi of PGH if he's ready?
Good afternoon, Madam Chair. Senator, it's my pleasure to be here. Just a quick maybe a summary of what's been happening with us in relation to healthcare. We are not part of the Department of Health, so I don't think we are in the program. But we have always played our complementary role in supporting the manpower needs of the healthcare system. Our graduates are distributed all over the world. In fact, 3 of the 4 center chiefs that spoke that are currently in place are from PGH or UP, proudly from us. And I hope we continue to do that as we partner with the College of Medicine, with the NIH, and with the UP Manila into developing programs that will lead to multidisciplinary care. Of course, we're talking about specialties here, but I think the future of actual healthcare will be in the capacity to do multidisciplinary care. So those are the pathways that we're opening up. But having said that, I think the other role that PGH can do also is to choose cutting edge areas where maybe not all hospitals can go to and decide if it will be viable for us or not. Example of that is we ventured against all advice to go into robotic surgery 2 years ago, and it has proven to be quite beneficial for our patients. And I think if we're able to push this and make it more accessible to a lot more patients, then it will elevate the service to our patients. So we are pushing now for molecular-based cancer treatment, having the Genomic Center as our partner with that. So I think that's the biggest role that we can have, and maybe share the template on how to do that. Currently, the concern, of course, is this pandemic, and we have looked at our master plan and are designing everything to be all the new buildings will have maybe 2 or 3 new buildings the next 5 years, and all of them to be pandemic ready, meaning at the moment's notice you close the doors to other patients and the building turns around to be COVID only or measles only, something like that. So we are also in the process of establishing the Institute of Emerging Infectious Diseases as a response to this, and we're currently finishing an isolation complex of 44 beds. I think the combination of all of this will allow us to educate more trainees, students, and specialists as well. And I hope that we are able to do this by expanding our capability. So we are putting up a 15-story neuroscience facility, a multi-specialty building, and we're putting up another 15-story cancer care building. And the third one, of course, is the PGH Diliman, where we hope to have another medical school to educate more doctors and specialties. So we are, of course, we'll be needing the support of the government in this, but we have ventured into a new modality of funding this. We have submitted the Cancer Center building in the PGH in Diliman to NEDA as a PPP project, and hopefully we'll get the approval of our plan soon and present it to the CABSEC. So we envision a PGH that's not only UP, but a PGH that belongs to everyone from all over the country. And I think the evolution of the teaching hospital should be one that it is open to anyone that is willing to learn and be educated. So I think in that aspect, putting up another PGH in strategic areas in the country for education and research purposes will benefit more trainees and students. So we maintain our function as a university hospital in line with the improvement of services to our patients. Thank you, Madam Chair.
Thank you. Just very quick response lang on my end. Yeah, I noticed, and I just kept forgetting to point out to USEC Lilibeth na bakit wala ang PGH sa role dun sa pinresent nyo, no? And yes, I know they're not part of the DOH system, but they obviously have ways to contribute. So may I just find out from you, Doc Gap, separately on maybe on your own, you can just submit to us how you can complement that. Kayo din, DOH, how do you want to use them? Kasi may level of expertise din naman talaga sila in a lot of those areas, not just one. And it is their mandate to train, no? So sayang naman if you're not tapping into them. In other words, whether it's heart center or lung center or NKTI na naka-assign to train these other regional hospitals, the PGH can also do that. You can assign them to train the others. That is their mandate. That is their job. That is what they're being paid for. So I find it it's not enough that they're training the future doctors. They should be training those doctors already in those areas. Second point I want to raise, Doc Gap, when you mentioned multidisciplinary care, I had a discussion with one of my mentors, Dr. Ernie Domingo, when we were debating the Doctor para sa Bayan Act. And he was of the view, actually my view, which I think I've shared with you and for some of you who've heard me discuss it, is that hindi lang doktor ang dapat scholar. We have to support the whole health professionals kasi the doctors naman cannot work on their own. And the numbers I saw from Dr. Dance naman showed that ang nurses pa nga by the year 2044, if we continue if we target a certain number of doctors per year graduates, we will get those number of doctors by 2044. Nurses, we never will. So I mean things like that. I need DOH to be on top of that so that we know what are these career paths that we really need to kailangan pukpukin para ma-achieve yun. Anyway, on the multidisciplinary care, Very quick response lang. Again, it's my lack of understanding of medical terms and all that. But would that be similar to the specialty of family care that is common, more common now that I hear a lot about it in other countries? In other words, cases in business GP ka, you go further in family care, which now bridges the different specialties. And then, of course, you still have specialists in different areas that you can go to. Because, again, what I'm hearing from some proponents of universal healthcare is yun dapat yung binibigyan talaga natin ng support talaga. I mean, again, this hearing was to hear the specialties, but I will always interject that this does not in any way set aside the need for basic healthcare. So is that what you're talking about,
So
Dr.?
primary care is multidisciplinary, but a multi-discipline function. I mean, a primary care doctor should be an obstetrician one time, a pediatrician another time, or maybe some surgeon in needed instances. The multidisciplinary care that is hospital based is that related specialties gather together and give their input on each case that needs to be treated, on each controversial or difficult case that needs to be treated.
I got it. So like a PGH or a Vicente Soto that has the specialties from all
the specialties.
Yeah,
yes.
not just one particular. I get it. Yeah. Okay. Okay, I see what you're saying. All right, I have more, and then I have one last point, but we can discuss this separately. I don't know if you caught my statement earlier about the model of Ateneo de Zamboanga. I'm a UP fan, you know that. But I was very impressed with Ateneo. Ang brother ko si former Speaker Alan, Ateneo Law graduate. So, kailangan pinansin na lang ng tatay ko ang Ateneo dahil yung isang anak niya nag-graduate sa Ateneo. That's just a UP joke. But on that note, I was very impressed with the Ateneo de Zamboanga model, wherein their medical students are exposed. I can't recall if freshman year or sophomore year, not exposed, but immersed in the communities. So I'd like to hear from you another time because I don't have time today, But basically, they don't even call it return to barrio or balik probinsya because they stay there. The retention rate is so high because parang embedded in their training is to serve the community. Now, I know PGH may have other visions because obviously a lot of the specialists, as you said, 3 out of the 4 specialty hospitals, PGH, UP Manila College of Medicine ang graduates ang head ngayon. So there may be other directions, pero I'm pretty sure you wouldn't also want to let go of that one of the most basic services we need to provide to Filipinos, diba? So you can respond very quickly, but I really want to go into depth on this another time.
Okay. We maybe I'll discuss with you at length the SHS, the Science Health, the special medical educational program of UP Manila in Coronadal, Palo, Leyte, Baler, and Tarlac. Maybe at the
okay, sige. Another time, kasi that's based on my law, the ladderized education, which was actually I sponsored that, but that was pioneered by the late Senator Ed Angara. So yes, I want to have that. Doon na lang siguro sa hearing on the health human resources kasi kasama naman yun eh. Thank you, Dr. Gap. May I now call on Dr. Eva Maria Cotionco de la Paz of UPNIH.
Yes, thank you, Honorable Chair, Senator Cayetano and Honorable Senator Binay. Resource persons, magandang hapon po sa inyong lahat. UP Manila recognizes the importance of education and training for human health resources. We will continue to assist the different regions by providing the specialty and subspecialty training in all the disciplines of medicine at the Philippine General Hospital, and you've heard that from Director Gap. The different colleges of UP Manila will also continue to provide education and training for healthcare professionals in the field of nursing, dental, and allied medical professions, and of course, public health for human health resource development in the different regions. And Madam Chair, just quickly to respond to all the questions earlier about the human health resource questions, as Director Gat said, UP Manila established the School of Health Sciences way back in 1976. So it's been here for 45 years to really address the lack of inequitable distribution of health professionals serving rural communities in the Philippines. We now have 3 campuses, Palo Leyte, Baler, Coronadal in South Cotabato, and just recently, last week, a Tarlac campus will also rise. The mission of this is, Madam Chair, is to stay the health workers who, so the SHS is to train clinically competent and socially conscious health workers who will stay and serve in depressed and underserved communities in the rural areas. It also has the mandate to develop a training model for the training of community-oriented healthcare workers that could be replicated in other areas. The school offers the step ladder curriculum. And this is where they can start as community healthcare workers, midwives, then subsequently as Bachelor of Science in Nursing, eventually as Doctor of Medicine. And the admission to this program depends on the needs of the community and the desire of the student to do community work. Rural communities actually nominate who will be the student assigned to them. So to date, the School for Health Sciences has graduated 200 medical graduates, 550 nurses, and 2,276 midwives. And the current students are 400 plus currently enrolled students, Madam Chair.
May I just interject, Dr. Eva? I was having a discussion with the doctors in Taguig City who are handling the COVID vaccine, the vaccination for COVID. And they mentioned to me that, when the crisis is over or more manageable, it would be a great time to really institutionalize or push for the ladderized program, the step ladder as you call it, for the BHWs. Kasi if ako, dati pa ako, ang laki ng paghanga ko sa kanila because I know how they go out. They're the frontliners who many of these Filipinos never even see a doctor. And forget about the specialist, di ba? Doktor lang hindi nila makita. So, minsan BHW lang. But the exposure that they've had, the cases that they've had to handle during this time, really expose them to more varied cases, and parang the timing would be really good to give them that opportunity to level up. So kindly explore that naman within the college, because the timing would be good. And in fact, you don't even have to wait for, like I said, the COVID to be over, kasi a lot of parts of the country naman manageable naman yung COVID eh. So on high alert lang naman yung mga BHW. So baka we can go out there and start training them for that next level, whether it's midwifery or whatever, no, a 2-year nursing program, if such a thing even exists. For the life of me, ang alam ko wala pa rin yan sa plantilla, and yet may colleges tayo na may 2 years nursing.
Yes, but Madam Chair, we can certainly explore that because we've been giving online courses. And I think the challenge will be doing the hands-on training, but we've done that as well.
But you can tie that up easily with the LGU, and then example na lang in Taguig City, sobrang dedicated ng doctors, they would be happy to bridge that they could be the mentors now in the real life training, diba? So marami tayong ways na magagawa yan.
Yes, ma'am. I think this is very, very doable in the very, we can set this up quickly, Senator. And just lastly, the National Institutes of Health, with its 14 institutes and centers, we can assist the regions in training and implementation of health research, because we think that's an important part of the whole scheme, no? Health research to address health research needs and gaps in their respective regions, to be able to help craft policies to improve. We found that out, Senator, when we did the National Unified Health Research Agenda, where we went to the regions, and this is with the Department of Science and Technology, Philippine Council for Health Research and Development. Each region, they had their specific health needs and that need to be addressed through the NURA. Madam Senator, we will be submitting our official statement to the Senate Committee Secretariat soon as po. Maraming salamat po at magandang hapon.
Thank you, Dr. Eva. Next speaker natin would be from PMA, Dr. Maria Roda Goco. Please, ma'am, you have the floor. Ma'am, you're on mute. Cannot hear you. Ma'am, I cannot hear you, Ma'am Rhoda. Ba't ganon?
Wala
Ma'am,
kang
wala pa rin.
sound.
Ma'am, pati sarili ko, minute ko na. Ma'am, wala pa rin. Did you try to detach it? Did you try to detach your mic? If you try to detach it, because that's probably why it's not working. Don't use a mic na lang. Can you try? Nothing? Okay. So, ma'am, your mic's not working. Can you talk? Can you just work it out with your staff? You just have a few more. Can you work it out? So, may I call Philippine Hospitals Association, Dr. Jaime Almora, and then we'll check on Dr. Roda if she's ready. Dr. Jimmy? Dr. Jilmy Almora of PHA, are you ready? Ako ba ang hindi niyo marinig? Nancy, can you hear me? You can hear me,
hear
diba?
you. I can hear you.
Yes, we
So-
can hear you.
Asan si Dr. Jimmy Almora? Are you there, Doc? Are you ready? Okay, wala pa rin si Dr. Jimmy. So, Mr. Chris Munoz of PAPO, Philippine Alliance of Patient Organization, are you ready? Mr.
Yes,
Chris Munoz? Yes, okay. Chris, go ahead.
Good day, Madam Chair and Honorable Senators. The Philippine Alliance of Patient Organizations was not able to submit its position paper due to short notice. Nevertheless, let us give our insights verbally in this hearing. Upon reading all the bills by our Honorable Senators, we are glad to hear that such importance is given on providing funds to establish public health facilities, modernization of existing health facilities, and establishing specialized public health facilities. This very welcome bill to the PAPO, and we fully support these bills. However, we would like to recommend that it be specific that we concentrate on the third class, fourth, and fifth and sixth municipalities, wherein there is lack of public health facilities, lack of equipment, and lack of healthcare workers. While there may be small private health clinics or hospitals in some areas, you would still prefer to have public hospitals since not all patients can afford to go to private hospitals. We have known patients to travel by boat or land just to get into the next province, just to be able to access affordable healthcare. Worse, they must travel to cities like Manila, Cebu, or Davao, just to name a few, to access facilities and doctors that would give them compassionate and affordable healthcare. It is very sad to learn that they have to spend so much just to be able to have access in our healthcare system. And the burden of indirect cost to one's health should be taken into consideration. As to human resource, we must learn how to do task shifting, wherein we maximize human resources, but up to capacity, as we don't want our HCWs to be overburdened. And hopefully, we can encourage more students to take up the various program or other health programs that government will provide. Integration of health programs is also essential, since this will save time, resources, and more efficiency in doing things. In the lens of universal healthcare and equity and Balik Provincia program of the government, we believe it is high time to concentrate the building or expansion of health facilities to these areas of concern. We cannot encourage people to return to their provinces wherein one would fear lack of access to healthcare when one gets sick. We cannot roll out our universal healthcare when there is lack or incomplete access to primary health centers, rural health units, or level 1 to 4 health hospitals. Lastly, and more of equal importance, is equity, wherein we address health inequities. When everyone has the opportunity to attain full health potential and no one is advantaged from this potential because of social position or any other social defined circumstances. That's all, Madam Chair. Thank you.
Thank you. Just to let you know, it is not lost to us on the need to emphasize support for the 4th, 5th, 6th class municipalities. Given yon, this bill really was focused on specializations, which would tend then to be in the cities, but exactly meant to reach out to the far-flung areas within those regions. But basic healthcare is would be the bigger expense, the bigger budget. So your concern is not just noted, but is part of the plan itself. As you will see it evolve when the numbers are being discussed eventually. Thank you. Are we ready, Dr. Rhoda Goko? Naayos nyo na yung inyong sound system? Ayos ba, ma'am? Wala pa rin. Sige, let me know. I'll call on another person. I can call on you again. We can try one more time after. Dr. Conrad Brana of PHA. Dr. Conrad Brana. Brania, is it Brania? His name is here, but he's not picking up. So, Dr. Rhoda, kaya ba? If not, don't worry, we will have another hearing. So, I just need to wrap this up kung wala na magsasalita. Ma'am, wala talaga. Kaya ganun. Sana nag-in and out kayo. Lumakas lang yung static eh. Okay, Dr. Conrad Brania, wala. So,
Ma'am, may Dr. Otaisa, Secretary of the PHA, can I just cover for the President?
Yeah, sure. Go ahead.
Okay. I think the most important issue that the PHA, which is composed of almost 2,000 members and 60% of which are private hospitals, the root of all our problems, I think, is with the private hospitals don't see themselves in the IRR of the universal health care. Although there are private hospitals that, for example, have or are capable of specialized care, they don't see themselves there in the network. But I think it may make it easier for central office DOH. I'm also from DOH, that's why I'm trying to bridge that gap. Is if they really tell us, okay, by regions, talk among yourselves who can really formalize that network so they don't feel all left out. No? We try to do it in the PHA, but the private hospitals, of course, have a mind of their own. And with the PhilHealth payments not being on time, which is a common issue until now, ganun na lang ho talaga ang nagiging issue palagi sa PHA. So I imagine also that they don't see themselves in the universal healthcare system really because they're not put in there in the IRR, puro government hospitals, DOH, LGU, which is understandable because that is supposedly a living document. It's still being created. Yun lang ho siguro ang marami ho kasing issues ang PHA regarding the hospital network. And mahirap din naman makinetwork kung hindi rin sila babayaran ng PhilHealth. You know, they would like to contribute. In fact, we had several meetings with.
May I just interject, no?
Okay.
On the payment of PhilHealth dues, I'm told by Secretary Dizon that has already been addressed, and it will be. They are currently being paid. It's not the. I understand that problem. That is major. I fully understand the concerns of the hospitals, but I'm told that it is being addressed. I'm told no less than the president has mandated for PhilHealth to pay. I think that was public info naman. So let's not go into that lang kasi this is already 3 hours na tayo, and I don't want to use that time for that issue talaga kasi hindi yan ang ano ko. I would like, and I hear you. I don't know enough about then how networking can work for the private hospital levels. If you and DOH can sit down together and give proposals, I'm very happy to read materials. If there are models in other countries, definitely for primary healthcare, I can see how that can happen. For specialization, I don't know because even for government hospitals, hindi nila nako-cover ang buong expense nitong mga napaka-technical na mga surgeries. So what more sa private? So I cannot begin to imagine how it would be covered. I just don't know. That's my point. I don't know. So I'm open, but ikaw nga sabi mo, kayo-kayo pa lang, hindi pa magkaintindihan kung papaano. So I really would suggest that you sit down. If you need us to sit down and mediate or join you, I'm happy to do that. Pero I need you to come up with concrete suggestions kasi hindi ko kayang hulaan kung paano ko hahanapan ng ano yun, ng bridge yun.
We've had several webinars talking about changing the strategies of hospitals. In fact, some hospitals are converting na lang to laboratories kasi nga at least mababayaran sila ng laboratory. But that decreases the bed density of the entire country. So parang pag iniisip from a national perspective, sasakit ang ulo ng DOH pag nababawasan lalo ng beds. Yun lang po, ma'am. Thank you po.
Well, I can easily ask a staff of mine to have further discussions with you and a few of your members. Wala namang problema yun. We're happy to do that to understand it better. I do not subscribe to the option of mawala at magsara naman yung mga ospital. Ayoko ng ganon, except lang yung may kalokohan, mamatay na sila. Pero yung matitino naman dyan and working very hard to provide healthcare, I want them not just to survive, but to thrive kasi that's their profession, just to make it clear. I'm very supportive. So I can have my staff naman sit down and try to find solutions with you. Sen Nancy, go ahead.
Yes, Sen Pia, siguro just to share, I don't know if this can be an example of a collaboration between government and a private hospital. I think kasi dun sa mga may biliary patients na kailangan ng liver kailangan ng liver transplant. Most of them, they would go to India for liver transplant. Kaso lang I think si PCSO, ayaw na niya magbigay ng pondo for abroad, for India. So parang naman siya tie up with, sorry kasi late na, hindi ko matandaan ko ano yung local private hospital. So pag doon ka nagpa-transplant, si PCSO, I think can give 1 million for that. St. Luke's ba yun? For that operation.
We gave them blood for a liver transplant.
Yeah, for that operation. So parang that is, I guess, an example of a collaboration between government and a private hospital na may ganong specialization na pwedeng i-fund pa din ng government. Maybe that is a program that can be explored by DOH with the private hospitals.
I'm sure if people put their heads together, Sen Nancy, I'm sure they can explore. Kasi it's not as if naman we have an oversupply, di ba, of the talented doctors and of the infra. So I'm sure talagang may way talaga. So,
and in fact, pati yung hospital din sa India, nagko-collaborate na rin sila with yung private hospital dito. Para hindi na rin, para pwede na rin gawin dito sa Philippines. And that, there's no need for them to go to India.
Yeah. I thought the example that you were going to give was the yellow card of Makati during the time of your dad. Kasi my son lived his whole life in the NICU of Makati Med. And yung classmates niya doon na walang kabayad-bayad were yellow card beneficiaries of your dad's program in Makati. So, yun, di ba? That's private and public. Wala pa yatang OSMAC at that time or baka nag-uumpisa pa lang. So, yung mga neonatal intensive care, nasa Makati Med sila.
And then siguro update lang. I think ngayon yung program, since may mga hindi kaya doon sa ospital ng Makati na kaya sa Makati Med.
Pa rin.
So parang may ganong arrangement.
Right.
Kapag hindi na kaya, we go to a private hospital that can treat them.
Definitely. So let's direct that to you, Sec Lilibeth, no? Dun sa areas, can you identify? Kasi nga, hindi naman talaga natin mapupondo to agad-agad, lahat-lahat. So dun sa may magagandang private hospitals who have the specialists and wala ka namang option, hindi mo mapapatayo ng infra doon, dun ka talaga mag-explore siguro ng tie-up, di ba? I'm sure there would be quite a few naman na meron.
Yes.
We'd like to see a few examples of that para to show naman na open talaga tayo dyan because honestly, these are doctors who could have gone abroad kasi yan yung some of them are my age, close to my age. They could have gone abroad, stayed abroad, but a lot of them came back and I know I met some doctors in the States came back to explore sa probinsya lang, wala, not enough support, no public facilities, balik. 'Di ba? So parang paano naman natin ma-address yun? I like that naman. Sana you could give us examples of that para we know that it's genuinely being pursued.
Yes, Senator. For private hospitals, we'll work with PHA po. We actually are asking the regions to plan together with the public and private hospitals to identify
natin kung sino yung masisipag. Kasi kung magaling sila magplano, mauuna sila sa budgeting, di ba? Kung pulido yung plano nila, maayos sila kausap, ganun lang naman yun eh. Kung mauna sila magsasubmit in the next few months, masasama nyo sila sa nila, di ba? Ganun na lang yung come on nyo. If you can get your act together, kayo ang masasama sa first batch. Right?
Tama po, Senator.
Ma'am Lilibeth, we could work with majority or small family-owned hospitals that could cover the primary health care need.
Yeah. Yes.
Yeah. Yeah, and I mean, itong I told you there are a number of bills here, 10 bills. My bill is general bill, and then it includes specialty. So it doesn't preclude supporting and pouring funds into basic healthcare, yung parang basic hospital, those with basic hospital facilities naman. So we need to wrap up at this point, everyone. Nancy, any other closing statement? Anything? Okay ka na?
Okay na.
Sige, Dr. Rhoda, one last attempt or next time na? Wala talaga. Next time na. Okay, thank you everybody for your time and patience. Next time, I will have to do a time check kasi I need us to be able to stick to the time, no? So I'll also ask my team to learn from this experience. Anyway, since everybody got to speak now, later on medyo mas targeted siguro tayo. Nancy, go ahead.
Cynthia, request lang kung pwede advance submission ng materials para we can also read it ahead of before the hearing, diba? To shorten then the time.
Yeah, Sen Nancy, if you had special requests, although I'm pretty sure my team took note, I'll ask my team to send it to your office to double check kung may additional ka pa na request. And then sa COMSEC din to give the DOH in particular and everybody else yung mga request ko, yung plotting nila for the 10-year future, etc. Para you can put together the for this, the data that we need, and then in the next hearing, ma-take up na yan. Okay? So this hearing is suspended until further notice. I won't give a date yet, but I really hope that maybe in 2 weeks we can get back together. Sana that's enough time because as the DBM representative said, nagdi-discussion na ng budget. So we need to get that to be, if we don't include this now, mahuhuli kayo at mas mahirap magpa-amend ng budget. So thank you everyone. Thank you for spending your afternoon with us. Take care. Stay safe.
Thank you.
Senator Cayetano. Thank you, Senator Binay.
Thank you.